Please come to order. Good morning. Welcome to the Commissioners of St. Mary's County meeting this day, Tuesday, March 16th, 2021. I am Randy Guy, President of the Commissioners of St. Mary's County. I'd like to introduce the other commissioners at this time. Sitting to my right, representing the 1st Commissioner District, which includes Ridge, Piney Point, St. George Island, Mr. Eric Colvin.
Good morning.
Representing the 2nd Commissioner District, which includes Leonardtown, Hollywood, Mr. Mike Hewitt.
Good morning.
Sitting to my left, representing the 3rd Commissioner District, which includes Charlotte Hall, 7th District, Golden Beach, and Mechanicsville, Mr. John O'Connor.
Good morning.
Representing the 4th Commissioner District, which includes Lexington Park, some of California, Great Mills, and some of Hollywood, Mr. Todd Morgan. Dr. Rebecca Bridget, our County Administrator, is sitting at the table to my left.
Good morning.
Elisa Cassis, our Communications Director, is sitting at the table to my right.
Good morning.
Amy Carter, our Video Media Producer, is behind the glass. Please turn your cell phones off or on vibrate. Because of the COVID-19 pandemic, the Commissioners of St. Mary's County declared a state of emergency on Saturday, March 14th, 2020, not knowing that a full year later, we would still be fighting this terrible virus. St. Mary's County has had more than 6,000 cases of the coronavirus. That includes 117 deaths. The loss of these 117 souls gives us pause to honor their memories, pause to grieve their loved ones, and pause to strengthen our resolve to entirely defeat this health crisis. Let's take a moment of silence now to pause and reflect. We are making great strides with vaccinations, and life is beginning to shift back to pre-pandemic conditions. But now is not the time to completely let up our guards. We must continue to wear face coverings, practice safe social distancing, and frequently wash our hands. We will get through this together. At this time, we will have a invocation and pledge by Commissioner Hewitt. Please stand.
Dear Lord, on this eve of St. Patrick's Day, it may be nice to do a Irish prayer. May God be with you and bless you. May you see your children's children. May you be poor in misfortune and rich in blessings. May you know nothing but happiness from this day forward. All this in your name, our Lord Jesus Christ. Amen.
Amen.
Please join me in the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Commissioner Hewitt. I now need the approval of the consent agenda.
So moved.
Second.
I have a first and second. All those in favor?
Aye.
Any ayes have it. Need a motion to adjourn. Let's see, do I have our health officer? Yes, she is.
I move to adjourn as the Commissioners of St. Mary's County and reconvene as the St. Mary's County Board of Health.
Second.
I have a first and second. All in favor?
Aye.
We'll now have Dr. Brewster come forward and give us an update and a briefing.
Back in the scrubs.
Yes, back in the scrubs. Busy week. Good morning, Commissioners.
Morning.
Morning.
Thank you again for your time this morning and all mornings. It's been a busy year, as you alluded to. And thank you also for that very special prayer, Commissioner Hewitt. It was very nice. And Commissioner Guy for leading the moment of silence. I think certainly there's much to reflect upon this past year. And many lives lost, and of course, many lives impacted, many families and businesses as well, lives impacted. So thank you. So we'll go over to the next slide. And, Commissioners, as you know, as you alluded to, we've been in this pandemic response for over a year now. And while we are due some time to look back and reflect upon this past year and the losses that our community and families have sustained. Unfortunately, we don't have the luxury of keeping our heads turned towards the past. And even now, as we're still down in this mud pit grappling with a wily virus, we need to look to the future and prepare our community better for the next fight. This pandemic's message has truly been stark and tragic. The impact of a single virus emerging across the world can strike us here locally with a force that flattens us, and within weeks has devastating impact on our healthcare system, our economy, the education and mental health of our children, and of course, our very lives. And in order to minimize this impact, we have to improve our local readiness, and we need to be better equipped for public health emergency planning, data analytics, information systems, as well as disease investigation and control. So again, as we sit here at this one-year anniversary of this thing, I wanted to share with you some of the lessons that we've learned as a St. Mary's County Health Department, and hopefully talk about some of the next steps that our community should engage in to better prepare us for the future. We don't want to be stumbling out of this long, dark tunnel bruised and bewildered. We want to be able to step forward ready and prepared for the next fight. Could you move to the next one, please? So I mentioned 3 areas of need in advancing our local readiness for public health emergencies, including other emerging infectious diseases. What we're really talking about is advancing our public health capabilities here locally. So public health emergency planning, data analytics and information systems, and disease investigation and control are the 3 areas that I'll describe individually. So our recommendations moving forward for the rest of this pandemic, as well as the post-COVID world that we all look forward to, is to strengthen and make more comprehensive our public health emergency planning efforts. And I've listed a variety of things here on this slide that are areas that we really need to strengthen locally. And I think the COVID pandemic has demonstrated to us the critical value of each of these items in being able to launch an effective and rapid response when emerging infectious diseases arise or other public health threats. All this language, I think, was foreign to many people before COVID, and now I think PPE is a common name, and lab capacity and surge staffing and all these things are common words to our community because of this pandemic. We've become very familiar with the need for these types of things. So I'm happy to talk more about these as you'd like, but I did list them here for your able to review it here. The major critical functions that we have seen that have been so critical to this pandemic response will continue to be critical for future responses, whether it's a pandemic or whether it's some other emerging infectious disease or whether it's another kind of public health threat. As we need lab capacity, we need the ability to be able to have an understanding of what our PPE capacity is locally and prepare and ramp up our PPE capacity quicker than what happened this time around. To be prepared and equipped, both with staffing and supplies for mass vaccination efforts and other types of efforts, including antibiotic prophylaxis, depending on the type of incidents. And then, of course, having a ready and willing and trained workforce that we can surge with in the future. So we don't take weeks or even months to develop a surge response. This is something that we need to be ready to activate and mobilize within days, not within weeks or months.
So, Dr. Brewster, how is our PPE supply right now?
So right now, our PPE supply is adequate for where we see this pandemic at this point in time.
Thank you.
Thank you. Yes, our partners have done tremendous work in acquiring or securing PPE supply. Our state, of course, has mobilized a lot of PPE supply to our county that then has become distributed across our different partner organizations. Right now, we're in a steady place. I feel confident with the PPE supply that we have right now for what we envision happening in the near future.
Thank you.
course, some of these timetables depends on the virus that we have.
Absolutely.
It takes time to develop a test.
Right, and as we saw with this pandemic, we don't often have that information in the beginning.
Right.
We learn about the
How quickly can you
virus.
mobilize until you have something to
Exactly.
add to the fall
right.
on?
And as we learned, we may not know how effective certain PPE is against certain infectious agents,
Right.
and what considerations we need to include, and what kind of decontamination for PPE would be effective against that particular agent. So there's a lot of considerations that all of these emerging infectious diseases, most of them are agents that we haven't dealt with before, that we have minimal scientific knowledge about.
Exactly.
And so as we deal with them, we're learning about them and we adjust. But we have to have a baseline foundational capability that allows us to then be nimble in response to the new demands or what we're learning about that new agent. The next is data analytics and information systems, and this has been talked about quite a bit nationally as an area of great need in this country when it comes to preparing for and responding to new infections. So what we're talking about here locally, though, there's a local capability that we need to advance, and that's what this slide is about, and the different points on here that I've mentioned that are critical capabilities for us to have locally. And we've done some of this in the COVID pandemic because we've needed to, but I'm telling you that there's not a huge capacity with that data connectiveness across different partners, across healthcare providers, that would allow us to be much more efficient. And we need that connectiveness to allow us to respond quickly and prepare for the future threats that we may face.
Dr. Brewster, what is the second bullet here, communication between electronic health records and public health?
Yeah, that's
data?
health informatics, essentially. So that's essentially where you look at electronic health records that a variety of healthcare providers, facilities, other organizations may keep, and how that data automatically communicates with public health databases, which is where we can look at data in aggregate, and we can say, okay, well, this seems to be an emerging trend in our community. We need to be concerned about it. Or we start to see where infections are popping up across the area, and we can start to predict when an outbreak is going to happen.
Is there any kind of privacy implications with this?
So
How do we
what
deal
happens
with
is when there's sharing, first of all, for public health purposes, that's covered under HIPAA. And so all of these systems are maintain certain protections that would prevent the disclosure of confidential or personal information. And then the data points that are shared are often shared in a de-identified way because you're looking at things on an aggregate basis. Sometimes they're shared, if they're going into like a registry, like a vaccine registry, you have to communicate identifying information with that. But when we look at it from a public health perspective and we start aggregating data, we're not pulling in the identifiers, except for things like geolocation and so forth. Okay. The last one is one I know that we've heard quite a bit about, especially in this pandemic, with contact tracing and outbreak management and so forth. And these are our capabilities when it comes to disease investigation and control. Our capability here, while we have survived and we have done what we can with the resources we have, we know that for the future, we can be much more efficient and capable and managing large impacts if we have better and if we have stronger disease investigation and control foundational capability. And so that's what this slide is about, is all these points that I've listed here. This is what disease investigation and control is about. These are the capabilities we need to advance locally to be better prepared for the next fight. A key part of this is the readiness to manage surge staffing. We have brought on a tremendous number of people to assist us at the health department, for example, as have other agencies locally, to respond to this pandemic. But these are individuals who don't have that long history of training or background in public health response or emergency response or infectious disease response. And so there's a lot of training and management of these individuals that's necessary. that are fulfilling the functions of contact tracing, outbreak management, and so forth, the testing, vaccine, et cetera. So to be better ready and to be better prepared to manage surge staffing, you need to have a strong foundation of trained and well-experienced staff. So, Commissioners, this is, again, this brings me to what we've proposed as a health department for our fiscal year 22 budget request, and I understand our budget hearing is next week, but I thought this time as a Board of Health, I would prepare you for some of the requests that we've made as a health department in that local budget request. Commissioner Morgan, I think you said it best when you said compensation and healthcare are the two biggest criteria to have any workforce stay stable. And that's really the thrust behind what we've put in our request for fiscal year 22. We recognize that we need merited staff to better handle any type of emerging infectious disease, any outbreak, the increase in outbreaks that we've been seeing here locally, that we've been seeing over the past 10 years, not just this past year, but also to better handle the future surge that we may need for any type of response to an emerging infectious disease or other public health threat. These are 6 positions that we've requested in our budget request to better meet those capabilities that I outlined earlier that we need to advance. We know, again, our agency has surged with a contractual workforce. That contractual workforce constantly comes and goes. And when there is constant coming and going of a contractual workforce, this really compromises your ability to maintain a steady and response that you can continue to ratchet up and build for your community. The constant retraining that's involved with a workforce that's constantly coming and going, even during a surge, really puts a strain on your continuing workforce, your merited workforce, because your merited continuing workforce is who you are tasking with managing that contractual surge workforce. And as the strain is greater on them, and as the hours already are too long, they're doing the right thing and they're stepping forward and serving their community at a time of great need. But we also have to be mindful that, when they're working 12, 15, 18 hours in a day, 7 days a week, that is an incredible strain. And when you are adding to that the strain of managing a contractual workforce that's coming and going constantly, that then leads to what you would expect. It leads to burnout. We've had several merited staff leave our health department because of burnout during this pandemic and the strain on them. And that strain is due to a chronically understaffed public health department, a public health preparedness, emergency preparedness, and infectious disease response. So that's why we focused our budget request so much on addressing that chronic understaffing and the chronic compromise of our public health readiness. Merited staff are the ones that you can properly train, that you build years of experience with, that develop management experience, that have experience with incident command structure, and that you can place in your incident command structure when an incident occurs. We have activated 3 different incident command structures as a health department that we've led just in the past 12 months. 3 different ones. We're currently managing 2 incident command structures for our current pandemic. That's an incredible, it takes leadership in all those different positions. It takes experience in all those different positions within that incident command structure. And that comes from merited staff who've been with you for a while, who've gone through the training, who've gone through the past experiences that they've also run. So again, our fiscal year 2022 local budget request is really a plea to our community to allow us the merited staff that we need to manage public health threats and emergencies and hopefully mitigate them before they fell us. Thank you, Commissioners. And I'd be happy to...
Before we go into that, have you passed this on to the state? your needs?
Yes, absolutely. But, what I'm outlining
How
here
have
is
they
what I've
they
placed in
responded
our.
yet to you?
Absolutely. And I think the state well recognizes it because they've also had severe shortages at the state health department that have contributed and compromised their ability to respond in this pandemic as well. What I've presented to you what I presented to you here is what I've attributed to local support. We have other plans that complement what I've outlined here and that address some of these capabilities that would be attributed to state support for our budget. You can go to the next.
One of the things beyond the FTEs that I think is important to recognize is some of your statements that you made about long-term contractual services, that contractors are good for a short-term period. They come in, they do what they do, but the long-term portion of it and how it totally affects the entire system.
Absolutely.
Overall, I think it's also timely as we're progressing and having discussions in emergency medical services. So thank you for bringing that up and how the development of actual staff is a long-term investment into the overall health of the county.
Absolutely. And like I said, Commissioner Morgan, I can't say it better than how you said it, is that when we invest in merited staff, we're also investing in our community. Not just from a readiness and organizational stability, but the people that work for us are people who live in our community. They need the benefits for their livelihoods. They need the stability in their jobs. That benefits our whole community, and it benefits our workforce because we don't have that coming and going that I was describing that you tend to have with a contractual workforce. And it's no detriment. It's no not to speak negatively about people who work contractually. I mean, they're incredible and they've been so critical to our response here in this pandemic. But as with any, they have families to be responsible for, and they're going to seek positions that afford them benefits. And if we've trained them and we are now relying upon them, and then they leave us to go for a benefited position, we've now wasted a lot of time and resources that could have been, better spent. Thank you. If we go to the next slide and click on the link there or go to the data page, I'd be happy to talk with you about where we are right now in the COVID pandemic status. We're at 6,118 cases. About 46% of our population has been tested at least once. There have been significant declines in our weekly numbers, our new case rate, and our local PCR positivity. So if we go down, you can see that all on the page there.
Can you bring those graphs, can you bring them, have we seen a
Over
drop?
to the side.
These things.
Yes, And so if you go down to the weekly case line, that might be a better image, Commissioner Hewitt.
I just
so
think
right here.
Leave off some of the earlier part.
Yeah, you can scroll it down. Would you like to go? We can do that one. That's fine.
No, it's your presentation.
Okay, sure. Yeah, it's on the website though.
They only go to like December. We're already into March.
You got to scroll the bar over. Yeah, you got to scroll the bar over. The bar underneath it scrolls it over.
I'm sorry, it's not a problem. Go ahead.
Yeah. So you can see here our weekly number of new cases. And so I was last time I came, I was a little worried about a plateau. So far, the subsequent couple weeks have been very encouraging. We have seen a decline in our weekly number of new cases. If you go down.
Great.
And if you scroll that bar over to the end, that'll show the full, and then this is the new case rate. And honestly, out of all these data points, I think this is the data point that we in the health department follow most because it's an indicator, of course, of incidence or new disease. And so this new case rate has declined significantly and continues to decline, which we're incredibly encouraged by. So very, very encouraging news.
Declining trend since what, December, January?
Yes, so as we've emerged from the surge, this surge has been pretty tremendous that we had post-holidays. And as we've emerged from the surge, we did plateau for a few weeks in there. We were concerned about that. I think last time I came here, I expressed my concern about that. But at this point in time, we're showing that we're continuing to decline in our numbers.
Is there a lot of decreases in the older population since more than?
Yes, so actually all age groups for the most part were decreasing. The only age group that we've been, the 0 to 19 age age group did bump up when we started back with hybrid learning in schools. We started seeing more cases in that 0 to 19 age group with a return to, coinciding with the return to public schools.
Okay.
However, that hasn't continued to shoot up. I mean, it's kind of plateaued. We are monitoring it and hopeful that that'll decline as well as community spread declines.
Very good.
Scroll down.
Yes, please. PCR positivity, if you could roll that scroll bar over to get to the end. Yep, same with the PCR positivity, it continues to decline. If you go down again. And then Commissioner Morgan, your favorite, the RT, if you could scroll that over. That also has declined significantly. We're down to a little less than 0.5 right now. And again, that's an estimate, but it is an encouraging trend that we're seeing with the RT. If you keep scrolling down, hospitalizations, we did see a slight bump up in the hospitalizations, and oftentimes it's because the hospitalizations and mortality do tend to follow weeks later after your surge. And so if you go down, it's a slight bump up. If you scroll that over at the bottom. But again, it's a slight bump up, and we'll continue to monitor that, and hopefully we'll start seeing that drop as we've seen our case numbers over the past few weeks drops. Okay, and scroll down. 117 St. Mary's County residents unfortunately have passed related to COVID-19, and that certainly is a very somber statistic. If we go down, fortunately, in all of our long-term care facilities, we are outbreak-free. So no active outbreak status in any of our 3 long-term care facilities at the current time.
That's great news.
That is awesome
really
news.
Great news.
Yes, awesome news, and I know it's a huge relief to all the wonderful staff and residents that are at each of these 3 locations, and then of course to all the families that have been worrying about their loved ones for months and months on end now. Really great news. Since we've last met, we have now confirmed the presence of the UK virus variant in St. Mary's County. We had 1 clinical sample, a nasal swab, that was analyzed by the state, genomics analyzed by the states, and they determined there was the presence of UK virus strain. As I mentioned before, the number of samples that are analyzed for genomics are very, very small, so we likely have more cases than that, just given the spread of the UK virus in Maryland that's already documented. But we certainly are hopeful that the genomics analysis will continue to expand so we have a better insight as to any other viral strains that might be in our community.
Are we still finding out that the Pfizer, Moderna, Johnson & Johnson is effective against the UK
Yeah, great
or
point.
the Brazilian or the South African? Or
Yes, more and more science seems to indicate that the vaccines we have available, all 3 of them, have some effectiveness against these common viral variants. There's some question about decreased effectiveness against the South African variant, but so far what we've seen with the UK variant is that that the vaccines are very effective against the UK variant as well.
again, side effects have been very mild to.
Yes, so most of the short-term symptoms that people have after getting the vaccine, which usually only last a day or 2, tend to be, the typical, a little bit of headache. Somebody might have some muscle soreness. They might get tired throughout their body and need to sleep, a little extra. Sometimes people get a little bit of a fever, but again, those short-term symptoms tend to last 1 to 3 days at
I
most.
know they've talked about AstraZeneca and that their vaccine may cause blood clotting or something like
So
that.
we don't have AstraZeneca vaccine here in the States at this time. There's a lot of studies still going on with that. In other countries, they've been using it, and they've put a halt to using the AstraZeneca vaccine. That's not one of the 3 vaccines that we've mobilized or approved here in the United States.
Okay, I just
Yeah.
heard that it may be, so, okay, thank you.
Yeah. But we haven't seen that problem with the 3 vaccines that we're using currently. If we go to the next slide, please. And again, just as a reminder to our residents that our vaccine webpage has all these things on it about, frequently asked questions and where to go for vaccine. We've now, the state has now opened up a state-run mass vaccine site at Regency Stadium. So you can go to our webpage and it'll get you to where you need to go to register for appointments at that site if people prefer to drive to go get their vaccine. The next,
How about the various pharmacies in our area?
yes, our local pharmacies, many of them are also providing vaccine. And in order to get vaccine from those pharmacies, you need to go to those pharmacy websites. So
I
Giant,
go to their website. Okay.
CVS,
I saw a sign in
Walgreens.
Strawell Hall that right there.
Yeah, so
They had
they
vaccine
have their own websites and the way they're managing how they,
Managing through the Maryland website?
no, the pharmacies manage it through
website.
their own websites, yes.
Okay.
They have their own, waiting lists and things like that they
Following the
manage.
same rules as
They
the
follow
state?
Maryland rules. There may be varying ways that they implement them, but they are beholden to Maryland's rules.
Okay, good.
Not necessarily local rules. They're beholden to the state rules.
But they're not limited to Maryland residents.
Correct. Yes, as you've observed, some of the state-run mass vac sites and the pharmacies are vaccinating residents from other states as well. Of course, that affects the availability of that vaccine supply that's now available for Maryland residents.
I did talk to somebody, and they said that the pharmacies are getting a lot less dosages. And, because I talked to somebody, you mentioned the one over here in Leonardtown, and the point is, I had an opportunity to talk to that person, and she said they got like 9 doses. And of course, but,
There was a lot of people there when
well, I
I
guess my point is all I'm telling you is what they said, but
Yeah, some of them, most of the numbers that I've been hearing of are, 100 or 200 doses a week.
so it's small.
I think a lot of those numbers are determined by their corporate offices. So Walgreens corporate or regional will determine how many doses each pharmacy gets in the different jurisdictions
Maybe they
and
get
so forth.
more, I don't know.
Yeah, some of those doses are coming directly from the federal government. They're not going through the state mechanism. And then some of them are going through the state mechanism and being distributed to the pharmacy. So there's not as much of there's a little bit of, multiple mechanisms that they're getting vaccines. So I'm not sure.
But I did check the website, and there was no appointments available
Yeah.
on any of the days that were
Yeah,
listed.
yeah. And we've heard multiple stories of people coming from other states and staying in our hotels and so forth to be able to get vaccine at the Walgreens or CVS or whatever it might be. It is tougher, I think, for Marylanders sometimes when you're competing with people coming from the region into your state as well. Yeah. But yes, that is a great option, and we are going to be relying heavily upon our pharmacies and our doctor's offices moving forward.
But the people lined up at the Hollywood Firehouse are St. Mary's County residents.
Yes, so for the most part, unless they work here. So if they're eligible by occupation and they work here, we'll vaccinate them. Yep.
So Dr. Brewster, in that regard, is following on Commissioner Hewitt, are our signups still full every single time?
So it depends on the week. So this week, we still have open appointments today, but as I'll mention in a moment, we're actually expanding our eligibility so that we expect those to fill up very quickly after that
Well,
expansion.
I think it's been great that we're getting, I think we had 1,700 shots this week.
Yes, so we actually added on some Pfizer to that, and we got some additional Pfizer that we were able to mobilize, and so we actually have a little over 3,000 vaccines that we're administering
Okay, so
right now.
we're really able to satisfy, I would sit there and say, our community's needs.
No, I think as we expand eligibility, we're going to have greater demand.
No,
Yeah.
excuse me, at this point in time, we're satisfying our community's needs.
If the community is adequately accessing our vaccine site and so forth, and I'll talk a little bit about some of the things we're doing to try to remove barriers. But yes, I mean, if people want a vaccine in St. Mary's County and they meet the current eligibility criteria, they can get it. We have appointments available.
So that means for everybody that's eligible at this point in time, we're in real good shape. So the real question sort of comes to when we go to phase 2, which is where people are knocking on our doors, when are you going to go to phase 2, when are you going to go to phase 2? Well, that is all, it's partially you, more the state, when they can open that doorway for us, or maybe that's.
Yeah,
later in your
so
presentation.
I'll be talking about expanded eligibility, and we are expanding our eligibility.
Yeah, thank you.
If we can go to the next slide, please. So this is, to your point, so we are expanding eligibility, and we have expanded eligibility. We started with the 40 to 64 population who has an eligible medical condition, and today we are announcing that we're expanding to 18 to 64 with an eligible medical condition. and we'll be adding on some occupational groups that are eligible that I'll talk about in a moment. So for the general population in St. Mary's County to be able to get vaccine at the St. Mary's County Health Department, this does not apply to the pharmacies here. This does not apply to the state-run MassVax site. They are staying in phase 1C for now. But St. Mary's County Health Department partnership that's administering vaccines, and that you register for at our St. Mary's County Health Department website, that's the place where these eligibility criteria apply. So any St. Mary's County resident, 65 and older, they continue to be eligible. They will continue to be prioritized. I encourage them, if they need help and assistance, to get on the callback list with the Department of Aging. We are making vaccine appointment offers to everybody on that list, and I can't thank enough the Department of Aging and Human Services and their team for all the incredible work they've done, weeks and weeks and weeks of work to make sure we get our prioritized population.
Dr. Brewster, on that, I was going to wait, but Ms. Harris, Jenny Harris's team and the health department wanted to say a special thank you, because I've been getting calls from seniors and they've had a hard time with the website. Literally told their caretakers, call over to the Department of Aging and Human Services, and I got a call back in 5 minutes that they were on the list and they're getting their vaccine after so many times of trying. So thank you very much. It's good to see that outreach. And
it's been a wonderful partnership, and we really appreciate them and their willingness to, make phone calls on a Saturday and a Sunday, and when we're posting links and so forth. I mean, they've really been a tremendous partner in all of this, and we are very grateful for that. Any St. Mary's County resident who is 16 or older and has a developmental or intellectual disability is also eligible for a vaccine through our St. Mary's County Health Department vaccine sites. And then what's new, we've this past week and a half, we've made 40 plus eligible with an eligible medical condition. But now, as of today, what's new is any St. Mary's County resident who is age 16 to 64 that has an eligible medical condition. Now, this list is narrow. I understand that. This list is primarily what the CDC has identified as a high-risk condition for serious COVID disease. There are other conditions that might be at higher risk for serious COVID disease, including asthma, but they have not made the CDC list of what definitively has very high risk of COVID complications. And so we pulled from some on that list, and we tried to match it up with what the state has said previously. And so that's what we have listed currently as those eligible medical conditions. There may be more eligible medical conditions added later when the state moves into phase 2, and at that time we'll reassess and we may expand which eligible medical conditions are able to access vaccine locally. But for now, this is what we've listed. At the very bottom, I just want to note obesity is an eligible medical condition. That means you have a body mass index, or BMI, that's 30 or greater. And there's a really nifty tool. If people are wondering if they meet that criteria, I see Holy in your stomach.
Might need it, I don't know. I got my shot.
If people are wondering if they meet that criteria, the CDC has a great BMI calculator. It's really easy. You just put in your height and weight, and it spits out what your BMI is.
That's a very embarrassing thing for somebody my size, because I'm going to be a massive blob.
Well, your height also factors into this, Commissioner.
It might not help me.
So if you put in a height and weight, I'll just pull out a random number. Let's put 6'1".
Uh-oh.
And then let's put, 260 pounds.
Well, that's obvious.
Uh-oh.
Okay, so there, the BMI would be 30 and above. And so a person with those metrics would qualify for getting vaccine right now if they're 16 and older. And they would need to bring with them some kind of verification, like a medical record or a letter from their doctor that says that because we don't have the ability with our team at the MassVax site, where we're trying to move through people quick, to sit there and check somebody's BMI and do a height weight calculation and so forth. We are rolling out a new strategy. We're going to be launching BMI booths that we'll have in the county where the health department will verify, so people don't have to get a letter from their provider, but we'll announce that next week. and once we have all the equipment in place to get that done.
You know, I'll say this about this BMI indicator, in all honesty. You have to be a damn rail nut to be obese in this thing.
Well, so, if you think about it, BMI was calculated, decades ago. That the studies that were done for BMI were from decades ago using tens of thousands of people and were largely slanted towards white Americans and were largely slanted towards certain body types. So people come in all shapes and body types and sizes, and some people are very muscular, and that muscle mass might throw their weight up and put them in the obese category, but their body fat percentage is actually quite low.
I'd have to lose 40 pounds to not be obese.
So, and again, muscle mass makes a difference, the density of your bones make a difference. I mean, all these things make a difference to weight. But this is one way that we're able to standardize it in a health system. And if you go to your doctor, I mean, pretty much when they check your height and weight, usually your medical record, your visit note will say what your BMI is. It automatically calculates it. Because we've realized that BMI is, for many people, a very reliable indicator of other kinds of health risk.
You should put a scale up there.
I'm close, real close.
Scale on the side. Up on the scale, you're obese, get in.
So for those watching, an easy way to get to this is just Google CDC BMI calculator, and it'll take you right to that webpage I just showed you.
Just glad they're not using the Army standard from back in the day.
Oh, no.
You can be
Or the height weight
6'1", 19 years old, and 20% BMI, and you're in trouble.
So
work you
so
real
those were
hard.
those were the people eligible through general population. We are also adding today some occupational groups that are from phase 2. So phase 1A, 1B, 1C, you've seen this before. They will continue to be eligible for vaccine. The new occupational groups that are eligible for vaccine, and again, this is for St. Mary's County residents that work in these occupations, or for people who work in St. Mary's County in these occupations, right? And they will just need to bring all that eligibility proof with them, and I'll go through that in a moment. These are the new occupational categories that we're adding as of today. If you work in transportation, and that includes auto repair, car rental services, if you work in critical utilities, Metcom, SMECO, any of the water management plants, gas stations. If you work in food services, this is where all our restaurants now become eligible. All the staff at the restaurants can now be eligible for vaccine. We want to get them vaccinated. They are at very high risk when people are in, especially people seated indoors, eating and drinking without their mask on. And so it's really important to cover them. News media, lots of in-person presence at events, covering freedom. That's how we're communicating about this pandemic and other key issues in our community. So working for the news media that serves St. Mary's County is going to be make you eligible. And then legal services, especially those that involve in-person courtroom work, that includes mediation services as well. And so to make sure that our courtrooms remain protected and all the people that are in those courtrooms remain protected. There may be more occupational categories that we add as we move further into phase 2 and as the state announces what occupational categories they will include in phase 2. But for now, this is what we're going to start with here for our local St. Mary's County Health Department vaccine clinics. Again, this criteria does not apply to local pharmacies. It does not apply to state-run mass vac sites. This only applies to the St. Mary's County Health Department vaccine sites. All right? And again, for these occupational groups, if there's question on whether they're eligible, we encourage them. We have an occupational survey on our website. We really want them to go there and complete that occupational survey so we can confirm to them their eligibility, and so that message can then be communicated to their eligible workforce. Verification of eligibility is required at our St. Mary's County Health Department vaccine site. We have made great progress, and we, as I'll show in a moment, have vaccinated a lot of people, but we want to make sure that, the prioritization schedule is being followed, and so we do check eligibility at the vaccine site. So this goes through what kind of eligibility documentation is required. If it's an eligible medical condition or disability, and that's what makes you eligible, then they need to bring some kind of medical record that has their name on it and the eligible condition on it, or a letter from their healthcare provider that says that they meet eligibility criteria. And then, of course, some verification of St. Mary's County, living in St. Mary's County and of their age. If they're eligible because of occupation, they would need a work ID or a letter from their employer that states that they're eligible based on occupation. And there's some additional options for eligibility for work, especially for farmers, for example, that we've also listed on our website. And they would need to demonstrate their age, that they are old enough to get the vaccine, and demonstrate either St. Mary's County residency or that they work in St. Mary's County. So again, if you're eligible by occupation, you could live or work in St. Mary's County. If you're eligible for the other reasons, you need to be a St. Mary's County resident. The question, and we've talked about this before, and I just want to draw attention to it for anybody who's watching, question about who's eligible related to the base and active duty military and civilian GS. So all of this is answered on the vaccine FAQs that we have on our website, and I'm summarizing a couple of key points here. This is what we have done in arrangement with the base. We have had conversations with base leadership and their medical facility as to how they are handling vaccine, and this is what we have agreed to. The base is getting its own allocation of vaccine to provide for their workforce. However, if somebody is eligible for vaccine, they might be eligible for health department vaccine if they meet the age criteria, they're 65 and older, or they have one of those eligible medical conditions and can show that documentation and come to the site to get it. But if they are eligible, if they are just based on their occupation, they would need to go through the base strategy that is in place for the base vaccinating. And if they have any questions, they can contact the medical facility on base to get that further explained. I know there's been a recent article in the Tester that also explains some of this. And of course, like I said, we have this fully explained out on our website and the vaccine FAQs that we have on our website.
And Dr. Bruce, in that regard, I want to thank you so much for work with Dr. Bray on the base. So if people working on the base have questions, not only read the Tester, look at this, but call Dr. Bray over there, because she can give you the definitive answer. And, don't do what you can, but Dr. Bray is the point of contact on the base that you should be using, if that's a fair statement.
Yes, correct.
So,
thank you.
Thank you.
Thank
Do
you
you have
very
any
much.
data on how many of the DOD at this base has actually used their service to get the
Yes, they've actually vaccinated quite a bit, and
they
I'll show the total numbers in a moment.
Oh, good,
Yeah.
good, thank you.
Thank you. We move to the next. So this is what's going on now in terms of our supply and actual who's been getting vaccinated. So far, there's two sets of data. There's the first set of data that you see, the numbers at the top, are the residents, the St. Mary's County residents who've received their first dose, over 23,000, and residents who've received their final dose, and that's over 15,000. St. Mary's County Health Department partnership that's administering vaccine has administered over 20,500 first doses, and of that, the final dose doses administered have been 11,652. So the base numbers are included in that first group of numbers where it says residents first dose, Commissioner Guy. As you can see, the metrics definitely have prioritized those seniors in our community. So well over 73% of 65 to 74 age group, and almost 70% of that 75 and older age group of residents. And these numbers don't account for everybody we vaccinated yesterday. The percentage of individuals 16 to 64 is also increasing, and so far about over 20% of our St. Mary's County residents have received their first dose. Go to the next slide.
With such a high dosage, how come our senior centers are still closed? Everything else seemed to be opened up 50% and everything.
So senior centers, their staff have been offered vaccine or are being offered vaccine and hopefully are getting them if they haven't been vaccinated yet. The state is having very active conversations, I understand, about opening senior centers, but they're not prepared to open them just yet. I think they're looking at a variety of indicators before they make that decision.
Okay, thank you.
But they have opened medical adult daycares, and we've also been communicating with medical adult daycares to make sure to get their staff vaccinated, fully vaccinated. All right, so I'm really pleased, if you go back actually to the pie chart before the slide, I'm sorry, thank you. So this is also, I brought up the concern last time about the racial ethnic disparities related to COVID and vaccine. We have seen some improvement in the number of Black residents who've been getting vaccinated here in St. Mary's County. Now, 12.1% of St. Mary's County residents who've been vaccinated with their first dose identify as Black or African American, and 1.8% of St. Mary's County residents who've been vaccinated with their first dose identify as Hispanic ethnicity. So definitely, we need to keep our attention on this. It is far less than what we would want it to be, based upon one, the proportions of population here in our county, and then also based upon the disparate impact that we've seen related to COVID illness and mortality on our African American and Hispanic residents. But we are continuing to partner very closely with our community, in particular the Minority Outreach Coalition and the NAACP local chapter through our Get Out the Vax campaign to improve our reach. Lastly, I really want to recognize and thank county government, specifically Department of Public Works and Transportation. They've been, just like with Department of Aging and Human Services and many other county government partners, during the course of this pandemic, they've been a phenomenal partner in so many ways. And especially now with our vaccine rollout, they're not only there every day at the mass vaccine site helping us to steer traffic, but they're also now partnering with us to be able to offer free transportation to our St. Mary's County Health Department mass vaccine sites to residents who don't have other means of transportation, which is an incredible service and will really be meaningful, especially as we continue to expand eligibility to more and more residents. So in order to get transportation assistance, and again, this is meant for residents who are not able to get friends or family or to help them or have their own means of transportation, people can call the St. Mary's County Health Department COVID hotline at that 301-475-4330 number and request to have transportation support to their vaccine appointment. They need to have a vaccine appointment first. They make their vaccine appointment. We will verify their vaccine appointment. We need at least 24 hours notice and maybe more if there's a weekend involved. And then we will verify the we will verify their vaccine appointment and communicate with our partners at DPW and transportation that need. And then STS will arrange a pickup for that person. This is a shared ride service. There may be multiple stops. There will definitely be more time involved than somebody going in their own personal car or getting a ride with a friend or family member. So people should anticipate that if they really need the service, that's when to use it. Otherwise, it would be best for them to coordinate with a friend or family member or use their own transportation. And that's it for the updates I was going to provide today. I'd be happy to answer any questions.
Tell me, Dr. Brewster, life after COVID.
Life after COVID.
Let's hope we're going to be there pretty soon.
Yeah.
But how do you see it? I mean, you talk about needing a surge of your training and staff, and it's obvious for the past year you've been under so much stress, Lord knows. But if these lines go away at the Hollywood Firehouse and we return to some semblance of normal,
Yeah.
What do you see as our biggest challenges going forward?
Yeah, I mean, as I outlined before, our biggest challenge is make sure we're prepared for the next thing.
Well, when you talk about disease outbreak and detection, I agree, but it just doesn't seem like you'd have that much new stuff break out in St. Mary's County versus if it came from.
You know, the trends would suggest otherwise. I mean, just in the past 5 years alone, I mean, what kind of public health threats have we been concerned about that we've needed to, you know, scramble around trying to prepare for? Ebola, Zika, now COVID. We certainly have seen more emerging infectious diseases in the past 5 to 10 years than, you know, we've seen in decades. And I think this is a consequence of many factors. Partly that we are more global as a world. I mean, people are traveling around more, and so things get around more. And I think we need to realize that this is probably our new normal. I mean, this is what we've been predicting in the scientific and public health communities for some time now, is that emerging infectious diseases are one of the biggest and most high priority public health issues of our time. And we are going to be seeing, and we have seen, a rise in the number of emerging infectious diseases. And it's not just new agents, it's agents that we've known before that are re-emerging or that we're starting to see antibiotic resistance to. Hospital acquired or healthcare acquired infections. That's a classic example where we've seen outbreaks related to infections people get in healthcare facilities, and these strains are mutating. The viruses and bacteria are becoming resistant to the antibiotics that we currently have. And as that happens, we start to see problems with them. So this is something that we have. It's been on the top 10 list of public health issues of our time for some years now. But we've seen proof of it. We've seen proof that there's more and more emerging infectious diseases to be concerned about. And our future likely holds new infectious agents or re-emerging infectious agents that we'll need to deal with.
All right, thank you.
Mm-hmm.
I think one of the things we have to look at is also the people choosing exercising their rights, or however you want to call it, it's to not vaccinate. The concerns with the possibility of a rise in polio, also smallpox. We've had those issues. I remember them popping up where it was a concern for the health department at some point. So
Yeah.
I think that is a concern, especially with schools and school-age children and the way our society is.
Yeah, absolutely. Our society is very communal, not just in schools, but, in nursing homes and restaurants and other places where we gather. Our risk becomes other people's risk as well. And that's why it's so important for us to keep our eye on community health and public health, because an individual decision has an impact beyond that individual.
All right.
Another good comment. I have a lady who sent me a text the other day. This lady never said anything good about anything or anybody. I'm constantly getting comments about the way the government is run and everything else. She had nothing but good things to say about your vaccines and your administration of them, both the first and second shot that her and her husband got.
Thank
Said it
you.
was well done. In and out within, 15, 20 minutes in the drive-through. She said, I was left home and back in an hour.
Yeah.
She said, that's great.
Thank you. Well,
Let you know.
Thank you. I appreciate you sharing
Somebody
that.
does
and-
recognize things like that, and to get a comment from her like that, I'm like, wow.
I appreciate that, and thank you. I mean, the community has been giving great feedback
Right.
that we really appreciate. Many people have been very kind and shared written letters or dropped off, snacks or whatever it is. And I just want to again, recognize that we've got an incredible team that's been working a lot of time.
Your whole team and everything.
Whole team has been awesome.
You're an all- great
And,
job.
we've got amazing people leading the effort. within our agency. Terry Prochnow, our nursing director, Jenna Guzman, who's leading all the communications, Katie Wells, who's our nursing planning chief, and a variety of others who've really stepped forward and made things happen. And we also have incredible community partners. I mean, the way we've come together here locally has just been phenomenal. Department of Emergency Service, the Sheriff's Office, I mentioned Aging and Human Services and DPW, our volunteer EMS and fire rescue departments. I mean, all our school system. I mean, everybody's really just done incredible work pulling together to make this rollout of vaccine work.
Okay.
Yeah.
Well, thank you very much. Any other questions, Commissioners? Anything else? Good.
Great.
Okay, thank you
Thank
very
you,
much,
sir.
Dr.
Appreciate your
Brewster.
time. Thank you.
Keep up the good job.
Thank you, sir.
Thank you. Need a motion to adjourn?
I move to adjourn as St. Mary's County Board of Health and reconvene as the Commissioners of St. Mary's County.
Second.
All ayes?
Aye.
Aye. Any nays? Ayes have it.
Thank you.
Thank you, ma'am. Next, we have a couple of proclamations. One is for National Social Work Month, and I think Commissioner Hewitt's got that one.
I got it. This proclamation, this is a copy, has already been given to Ms. Jennifer Neff, Acting Assistant Director of the Social Work Services. Let me read this for you. Whereas the primary mission of the social work profession is to enhance overall well-being and help meet basic and complex needs of communities and people. Social workers work with many different populations and types of people, particularly focusing on those who are vulnerable, oppressed, and living in poverty. And whereas the theme for this year's Social Work Month, Social Workers Are Essential, recognizes the extraordinary contributions of social workers during the COVID-19 pandemic, where their work with our community's most vulnerable adults and children has remained a priority. And whereas child welfare social workers specialize in building upon the strengths within a family and their community to help provide a safe and loving environment for their children. Social workers strive to meet the needs of an increasingly diverse older population, which can present both challenges and opportunities. And now, therefore, we, the Commissioners of St. Mary's County, do hereby declare the month of March 2021 National Social Work Month in recognition of the numerous contributions made by America's social workers, and call upon all citizens to join with the National Association of Social Workers in celebration and support of the social work profession. This date, March 16th, 2021. Thank you.
Commissioner, would y'all please stand?
Your voice. Thank you so much.
Thank you. Thank you. And next, we have a Equal Pay Day by Commissioner O'Connell.
Very good. This proclamation, the mic's down here. This proclamation is going to be presented to the Commission for Women, I believe. And this week, before I read the proclamation, they'll be hosting their virtual symposium for the Women's History Month. Now, usually we have a big dinner and awards ceremony all together, but we can't do that this year, again, because of COVID. So Thursday, March 18th, 6 p.m. on Facebook. It all goes live then, so tune in to that on the Commission for Women's Facebook page. This proclamation reads, whereas 58 years after the passage of the Equal Pay Act of 1963, women and people of color continue to suffer the consequences of inequitable pay differentials. And whereas the Civil Rights Act of 1964 further strengthened laws for gender equality, and whereas according to statistics released by the U.S. Bureau of Labor Statistics in 2020, women had a median weekly earnings of $344, or 83.4% of the $412 median for men. And whereas over a working lifetime, this wage disparity impacts Social Security benefits and pensions, and whereas fair pay strengthens the security of families today and eases future retirement costs while enhancing the American economy, and whereas fair pay equity policies can be implemented simply and without undue costs or hardship in both the public and private sectors, and whereas Equal Pay Day was originated by the National Committee on Pay Equity in 1996 as a public awareness event to illustrate the gap between men's and women's wages. Now, therefore, we, the Commissioners of St. Mary's County, do hereby proclaim Tuesday, March 16, 2021, Equal Pay Day in St. Mary's County and urge the citizens of the community to recognize the full value of women's skills and their significant contributions to the labor force. This date, March 16, 2021.
I got to make a little comment about this because unfortunately I had two ladies that reminded me that March 16th is not Equal Pay Day.
It's not.
It is not. I need a little more research on this. I was told it was more closer to April 20th.
Yes.
You know that for a fact?
I know that it's later on in the year.
Okay, I'm just wondering, I just was criticized last night by two ladies. Not criticized, but reminded that today is not Equal Pay Day. That
Well,
it
let's
actually
just
extends into
proclaim it
April.
a month then, from now until then, since presented today,
Right.
in recognition of that.
And I'll recognize it again when April, we find out for sure what day it is. But to the two ladies who reminded me, we'll check into that. Thank you very much.
There it is.
Okay, next we go right into our main agenda items here. Department of Land Use and Growth Management decision, proposed amendment to the official zoning maps of St. Mary's County to delete the existing 1,000-foot critical area boundary line and replace with a new critical area boundary line from the statewide base map as required by House Bill 1253. Mr. Bill Hunter, Director of Land Use and Growth Management, presenting.
Good morning. Thank you, Commissioners. Dr.
Morning.
Bridget.
Morning.
The appointment to appear this morning began with the purpose of asking the Commissioners for your decision on adopting zoning maps with the new 1,000-foot critical area boundary. At the public hearing on March 2nd of this year, the Commissioners discussed the possibility of requesting approval from the Critical Area Commission to allow some grandfathering or other exception for projects that could be undertaken and completed using the current critical area boundary. To this end, Commissioner President Guy sent a letter to Critical Area Chairman Charles Deegan asking about this possibility. On March 9th, Chairman Deegan and Critical Area staff held a virtual meeting with Commissioner Hewitt, Dr. Bridget, Attorney Weisskopf, and me to discuss the possibility of a limited exception. Chairman Deegan sent a letter coincident with the virtual meeting with an example of a temporary exception that had been granted to another Maryland county, and that letter from Chairman has been included in the Board Docs report for this item. The example from the Critical Area Commission has been incorporated into a draft ordinance prepared by Mr. Weisskopf. The proposed new text would provide additional time for owners to begin construction projects using the current critical area boundary. If authorized by the Commissioners today, County staff will ask the Critical Area Commission at its meeting of April 7th for authorization to proceed with the amendment. Are there any questions? Mr. Weisskopf has been instrumental, and he's in the room also if there's questions about the legal aspects of this.
Any questions, anyone?
Do we have any kind of confidence level on what the Critical Area Commission will say about this?
Yes, sir. Just how large they might extend is a question, but the fact that Mr. Deegan, Chairman Deegan, in his letter, sent an example of something that had already been approved by the Critical Area Commission, to me is evidence that they will strongly consider a request from us. Because otherwise, I think for everybody in the room on that call, or in those rooms on that call, the fact that there had been an extension granted for a Maryland county was news. In other words, the Critical Area Commission had done this in one instance, but had not publicized its availability to other counties who may want to take advantage of it.
Okay.
Well, I'd say this is all generated by House Bill 1253 that was passed in 2008. Now, people have reached out about grandfathering and can they come in under the old rules, but my thought process is, or maybe what I'm thinking is, we can only do that if they're in the process, if they've applied for a permit. Is that true?
What this would do would be, pending Critical Area Commission okay, we would publicize that there is an additional window for people to apply before the maps would be adopted. So as of this day, they don't have to have applied pending our ability to discuss this with the Critical Area Commission.
Okay, I do know that the county that did apply, Anne Arundel, they had actually worked within the 2-year time frame and then requested that approval while they were still, we're outside of that 2-year time frame. So it kind of looks like, it may look like, I'll say, let me put it that way, it may look like we've already had our time and we should have had this done by now. So going forth and asking for an exception, well, we'll just have to see how it goes. But everybody, go ahead.
I was going to say, I'll accept the criticism for that.
No, it's not a criticism of you, Mr. Hunt. The point is we had this meeting 2 years ago, and this place was packed. And that night, many people had an opportunity. And the Critical Areas Commission did reach out to many of them individually and met with them. And out of 2,000, we ended up, now we're finally at the deadline, kind of, hey, here it comes down, you have to have it done. Now we have 23. Now 23 responses out of 2,000. And most of the 23 seem to be people saying, hey, how's this impact me? And you've done a great job of showing them that. Now what some people have reached out to me, specifically one family, is they've known about this, but they haven't been in a financial position to be able to do something about the deck or their addition or whatever they want to put on their house. They just haven't been able to. And with COVID, it hasn't been any better. So the point is that they've asked that if they granted an extension, let's say, for instance, we grant, what, 6 months is what we're going to ask for an extension?
We'd ask for a year, sir.
A year extension on this thing? So we want to go till this time next year?
I thought it was 2 years.
This would be
Yeah, I thought it was a
permits
2-year.
associated with the development.
Yeah, but I'm talking about, that's probably before completion of the project, isn't it? We're not going to ask for a 1 or 2 year extension of this 2-year time frame we had, are we?
Why not?
Yeah, why not?
What we have proposed following the Anne Arundel, I believe it was Anne Arundel, whichever
Yes, Anne Arundel County.
it was, was that permits associated with the development, well, let me get the right section here. Construction allowed under the issued permit would be initiated by May 18, 2023. So we're asking for 2 years.
So the permit has to be started by May of '23?
That's what it says. Construction allowed has to be initiated before May 18, 2023.
So we're essentially asking for a 2-year extension,
Yes, sir.
May of '21 to May of '23.
And we don't know if the Critical Area Commission would see it that way or not.
I'm only one member, I don't know either. But nobody else is, I mean, this, okay, go ahead. We'll just see how it goes.
Well, but since you are the member, how do you think the commission feels? I mean, I realize they want the power, but the question is.
It's not a matter of power, Commissioner Morgan. I think it's like, hey, look, this has been out there since 2008. It came in 2018. You know, it's kind of like going on 3 years now, fellas. So, again, I don't know. All we can do is ask and see.
Let's just ask for it. If the commission denies it, then or it gives us a different direction, we'll take it.
Yeah, I see no reason to infringe on people's property rights if we can go ahead and have as much time as possible and extend it as much as possible. Beyond the Critical Area Commission, I wonder if, because as you mentioned with COVID and financial things, if there is if there's anything in the executive orders that allow us to notify the governor to put this off
I'm sure they
based
take
on
that
the
into
decision.
consideration, all that.
Yeah, so, it's been done with other ones, so I wonder if there's something there that would allow a decision to be put off based on exactly what you said, and also the fact that people haven't had the money to do it, they've been laid off, puts them in predicament. So, that's, to me, the law is not just the law. And then there's always an exception, there's always case law, like I previously said. So there's always ways to work within the confines of it and make it happen. So, all right, I move to table the decision to adopt the official zoning maps with the new critical area boundary line required by HB 1253 to enable county staff to meet with the Critical Area Commission to request a deadline extension to develop a text amendment to allow qualifying projects to develop using the current critical area boundary with timelines acceptable to the Critical Area Commission, authorize Commissioner President to sign any related documents.
Second.
I have a first and second. All in favor? Aye. Any opposed? Ayes have it. Thank you, Mr. Hunt.
Thank you.
Next, we have the Office of the County Attorney Legislative Update. Mr. David Weiskopf, our County Attorney.
Making up for last week, Mr. Weiskopf.
Yes, I might need
Wait a minute, my package is under this stick.
I might need an FTE to carry
Yeah, it makes sense.
So, good morning, Commissioners.
Morning.
Let's start off with memo number 1, which basically starts off with a note from Mr. Kevin Canali, who states that everybody is a little nervous that bills are backed up because of, COVID and health measures, that the bills are supposed to clear their chambers by next Monday, right? So it's going to be hot and heavy the next couple days. And to start off, we were going to talk about the State Board of Elections bill, which is House Bill 1038 and Senate Bill 747, which is actually a MACO legislative initiative to clarify and update election laws with an emphasis on fairness, transparency, and accountability. Something about a prohibition related to ballot drop boxes. And we received an email asking for our support. So we have a proposed motion. I don't know if the commissioners that are to go up there want to discuss this at all, or?
I wouldn't say we've been up there, but this has been, the bill has oftentimes sort of been jumbled in the past, and MACO is just simply trying to get some clarification so everybody across the state is being looked at this thing fairly, and it isn't sort of like 655 where you try to change the rules on a few affected counties and leave the other ones unaffected alone. So I move to support HB 1038, SB 737, State Board of Elections, membership, contracts management, ballot drop boxes, and voting system financing, and to approve and authorize Commissioner President to sign letters of support to the House and Senate committees for these bills.
And I'll second that with a friendly amendment of SB 747, not 737.
Okay, sorry, fine.
Is that right, 747?
747, yes.
Okay. Have a first and second. All in favor? Aye. Any opposed? Ayes have it.
Thank you, Commissioners. Next, to discuss the blueprint for Maryland's future, i.e. revisions, Senate Bill 965 and House Bill 1372. These are emergency bills that propose multiple changes to the recently enacted Kerwin blueprint legislation and would also alter maintenance of effort calculations for fiscal year 2023. MACO has, at this time, my understanding is, has no position on the bills. The Senate bill was heard on the 15th, yesterday, and the House bill was heard yesterday as well in committees.
We met last Wednesday on this for some time, probably an hour and a half. The gist of it is that with the COVID, with the economic fortunes or misfortunes of the state and Kerwin, what we see is the under the BRFA and also under the current revisions, the state is attempting to hold counties harmless for the reduction in students towards the maintenance of effort, such that a calculation would be given that if you give the school system maintenance of effort plus $1, you meet the criteria. The next piece is how you would begin to implement Kerwin, and because of the fact that all these things have taken place over the last year, it would delay the implementation of Kerwin for a year. So we got a big, long chart and things like that of how counties will be affected at the end of the day as long as you continue to meet whatever the statutory requirements are. And quite frankly, from St. Mary's point of view, we're one of the few counties out there that are good, I'll put it that way. Some counties have got to come up with millions and millions of dollars in order to meet the Kerwin requirements, and you sort of just kick the can down the road for a year to this will start all over again. Quite frankly, the counties that are in the worst shape are the ones up in the big 5 urban counties, a couple of the rural counties along the way. So at this point in time, recognizing that this still has a way to go in a very contentious year along with the budget, I can see why MACO at this time is holding no position, but I wouldn't sit there and say that MACO is not going to come back later as these revisions, quote unquote, take place and amendments get amended to the revisions.
Thank you, Commissioner. It will be, as I said, that's why we're just keeping an eye on it.
Yeah, that's a good one to keep an eye on because
That's good to keep
it's
an eye on,
a
believe me.
lot of money.
A lot of money.
A lot of money.
Right. So that's what we're doing. Now, the next 10 pages are about what they call police reform and accountability. There's multiple Senate bills and House bills, but I thought maybe it might be best if I discussed House Bill 670, which was the large one, which did pass the other day, the House. And, you know, it was 4 hours of debate. There were 17 unsuccessful amendments. There were 10 successful amendments. And if you look at House Bill 670, it's 66 pages. And as I said, it's called the Police Reform and Accountability Act of 2021. And my gleaning of it, it's really the omnibus bill that incorporates a lot of the different smaller ones. For example, the first thing it does would be to repeal the Law Enforcement Officers' Bill of Rights. It would raise the bar for no-knock warrants to need to be approved in writing by the state's attorney, by the police supervisor. You would need to show clear and convincing evidence. Third, at stops, you need, traffic stops, you would need to give identifying information, reason for the stop. 4, a police officer cannot prohibit a citizen from, videotaping them. 5, there would be, loan assistance for police officers for education, scholarships, to be done in a diverse way. There would be employee assistance programs need to be developed. They would be mandatory in some instances, and that each agency would have to develop their own EAP and do so at a minimal cost to the police officers. 8, there would be changes to the Local Government Tort Claims Act. I believe they would be upping it from, what is it now, 400 and 800 to 600 and 1.2. There would be a state PIA compliance board changes. There would be an independent investigative agency created to review use of force incidents by police officers. Each county will have police accountability boards. They will have regular meetings. They will be, the members of the police accountability boards will be members of the trial boards, and there's something new called charging committees, which, will review use of force. They will also receive complaints of police misconduct, and that can be anonymous. An administrative charging committee is going to be made up of public defender appointees, state's attorney appointees, and guess who else?
Who? You.
Me. So again, another reason for an new FTE, right? So good thing I read it, I guess. The committee will have to be trained. The trial board, they'll have changes. They're talking about putting a retired district or circuit court judge on it. which might be easy in larger jurisdictions, but I don't know if, we'll be able to do it in some of the smaller ones. The sheriff has to designate an employee as a victim rights advocate. Sheriff's got to create a database. There's going to be police officer whistleblower protection. There's new discussions about secondary employment and political activity. Something called implicit bias training for, I think, the public defenders and the police officers. I wasn't really familiar with implicit. I'd always heard it as infinity bias, but there's different names for it, right? Which basically, I think, comes out to, people have an unconscious bias to like people like themselves and not like people who aren't like them, right?
That pretty much sums it up. Some of the training I've attended multitude of that training, and it just depends on where you get it as to whether or not it's quality or not.
Oh, certainly.
There's some that are extreme, and then Legit offers one that's amazing. So it's just a matter of how you attend it.
There's going to be mental health and physical agility assessment required for police officers, and then it'll actually be annually. Thank goodness we don't have that for me. Prior marijuana use will not be a disqualifier. The revoke of police certification if you violate the use of force, perjury, felony, previously been fired or designed. There's going to be a statewide database to track decertifications. Another part is if you apply to a new agency, that the new agency can contact your old agency and get your personnel and disciplinary records. There's going to be new reporting for SWAT teams. Body-worn cameras will be required. Obviously, there'll be some requirements about getting all this information out to the public. There will be a use of force statute, which outlines the force you're allowed to use and not use. The sheriff can't get surplus drones, aircrafts, vehicles, grenades, or silencers. There'll be a manslaughter if, a police officer could be charged with manslaughter if they use lethal force and someone is killed, or they could be charged with reckless endangerment if the person is not killed. And police officers in certain instances could lose their pensions. So that's what I gleaned from the major points of House Bill 670, which I think is most of what the reforms are, with the addition, there's some other ones out there about the school resource officers, which we touched upon and discussed. And like I say, I'm happy to go through these 10 pages of bills, but anybody who's interested, obviously, the public, can pull up board docs and see them all. Wow.
Just one question. I think one of the points you mentioned early on in there is it makes it legal to record a police officer. Are you not allowed to record a police officer now? I thought you could.
So it's already legal.
Right.
You just can't interfere with their investigation, so you can't stop them from doing their job. There's already case law established on the ability to record a public servant.
And some of this, if you bear down on it, is stuff that's already existing. Like, for instance, the specific bill on police liability, if you bear down on it, you still need 3 things, right? It has to be more than negligence.
Yes.
Right, which is, a very high standard. You have to go outside the scope of your training and, standards of police, and there can't have been misconduct, right? So if you still meet those 3 things, you're not going to be liable. Well, I mean, that's kind of the case now, right? If a police officer goes above and beyond and acts with complete and willful and wanton conduct, they can be sued.
Yeah, and it's also the supervisory negligence that goes along with it. If the supervisor didn't act appropriately, knew there was things going on. But a lot of this stuff is already law or policy. I don't understand the repetitive nature of what they're doing, because there's one part in here that you can get access, you're allowed to have access to the records of the previous agency. you already have to go to the previous agency, otherwise you can't get certified as a police officer. So it shows a lack of understanding that these legislators actually have for the laws that's already in place and what they're doing. But I do think that the public needs to understand there is something in here that got through, which is the legislature is saying that police officers can only serve search warrants between 8 a.m. and 7 p.m. All right? I mean, heck, hey.
Don't wake anybody up.
Yeah, don't want to wake anybody up. Just give you that time frame to get all that criminal activity and evidence out of your house and go from there. There's just a lot in here that, I mean.
There is, and more to come, and obviously there's going to be a lot of discussion in the Senate, and
Yeah.
and the Senate bills don't quite match up to the House bill, so there'll be a committee, and
I can tell you from the risk management point of view, I know that the raising of the tort claims is not something that the local government insurance trust would want to see.
well, certainly, and it has, county government and local government just doesn't get sued because of, alleged police misconduct. There's a
Yeah.
lot of other things that, certainly. So we'll keep an eye on it, and
I'll interject first, just so House Bill 670 went forward, and there were numerous Senate bills that came the other way. It should be known for the public that Delegate Crosby voted in favor of HB 670, and Delegates Morgan and Clark voted against it. When you look at the Senate side of the House, there were numerous bills that have crossed over to the other side, and in particular, I know that Senator Bailey and Senator Jackson were very hard on putting amendments in. I respect senators both sides, Jack, because he was a DNR cop, and Senator Jackson used to be the chief of police of Prince George's County, so I think they understand the law enforcement side of the House. Unfortunately, many of their amendments didn't get through. So where we are now is 670 crosses to the Senate. All the Senate bills cross to the House. They'll have to parlay what comes out of this at the end of the day, but I'm going to think they're going to be spending a lot of time in Annapolis over the next till April 15th, whoever signed die is, negotiating all this. But please just bear in mind, folks, how your legislators vote on these issues and how it affects you at the end of the day.
I think you made a very valid point on that. There's a lot in here that is not going to reach the constitutional test. At telling a judge what they can and can't do, at telling them what is probable cause and what is not probable cause. I mean, you can't add to already established case law. So I see that there's going to be a lot of contention over this, and I don't see, there's going to be some attorneys that are going to be making some money if this gets through. And they should look at this, that Delegate Crosby voted for basically the systematic dismantling of law enforcement. I really truly feel they missed the mark on this. They had an opportunity for true reform in policing, and they focused on the wrong area. They truly did. They missed it, and they had momentum to try and actually make some really good changes. Unfortunately, they allowed Fox News, CNN, and everybody else to drive it, so that's unfortunate. But either way, I appreciate your staff bringing this up because it is important to many people.
it is. I didn't realize there was so much on it until I started reading it. And to draw your attention to the last page, there was an update that the public facility bonds has passed the Senate and is now moved into the House. So that is steadily going along. And then to discuss memo number 2, if there are no questions.
Oh, did you need a motion to oppose that?
For
670.
House Bill 670. We're going to discuss that in memo number 2.
Okay.
We can do it now if you'd like. If you flip to the second page of memo number 2, where it discusses House Bill 670, there is a motion if you would like to approve and authorize Commissioner Guy to sign a letter of opposition to it and forward it to the Senate committee.
Where are we?
Speaker of the House.
Yeah.
Page 2 of memo number 2.
Got it.
Yeah. I move to oppose HB 670 and to approve and authorize the Commissioner President to sign a letter of opposition to HB 670 to the Senate Committee and Speaker of the House.
Second.
I have a first and second. All those in favor? Aye. Any opposed? Ayes have it.
Thank you, Commissioners. And to let you know, on the first page, House Bill 655, it's just moving its way into the Senate, and I know the local Southern Maryland delegation met with the local, Tri-County commissioners and discussed it, so.
Well, I move to oppose HB 655 and amendment as amended and authorize the Commission President to sign a letter of opposition to HB 655 and to a voter referendum to request an amendment to put in contents of HB 655, County Commissioner, County Boards of Education, district voting, plurality of voting to a voter referendum for the people of St. Mary's, Calvert, and Charles counties, if they vote to agree, to decide and vote on the 2022 election.
Second.
I have a first and a second. All in favor?
Aye.
Aye. Any opposed? Ayes have it.
Thank you, Commissioner. And then the next two were, well, as you know, House Bill 670, which we discussed.
Right.
And then it shows you the Maryland Police Accountability Act of 2021, all the different Senate bills that are advancing. And then really the only thing left to discuss was Delegate Crosby's House Bill 1364, Senate Bill 946, just letting you know about the historic St. Mary's City Fort 400 Commission, because I guess the 400-year anniversary is steadily approaching.
Okay.
We are one old state.
And there's going to be a,
2034?
Yes.
yeah.
Oh, that's a little ways away, isn't it?
You know, well, they must be planning one heck of a party.
I tell you.
There's a big
There's going to be a
push
really good Maryland Day celebration coming up on March 27th, I believe. Not only at St. Clements, but at St. Mary's City, so I just encourage everybody to stay tuned.
Great. And that's all I had, unless the commissioners have any questions or any guidance or direction to.
Now, just tell me, HB 528, the excise tax over the impact fee, that's moving along fine, past the House?
Yes, it's passed the House and it's in the Senate.
The one last thing on 670, if you do read down into it, I do believe it in certain aspects it infringes upon the duly constitutionally elected office of the sheriff based on his the Maryland Constitution as well. So I'm interested to see how that would be applicable, even though it's a state office, as the primary law enforcement agency for our county. How would the county have to move outside of the Attorney General's office, well, to support the sheriff, if that is the case, and ensuring that none of his constitutionally authorized powers are infringed upon,
Right.
Ensuring that the safety and security of our citizens are still there. So,
Let's keep an eye on.
yeah, so.
Thank you, commissioners.
Thank you all very much. Thank you very much, David. Now we'll move right into county administrator time.
Thank you,
Bridget.
Commissioner President Guy. Commissioners, first is your draft meeting agendas. So next week is Tuesday, March 23rd. You have your weekly update from the Office of the County Attorney on legislative updates. You adjourn your morning meeting and reconvene at 1:30 p.m. with the Department of Finance for your budget work session. The next week is Tuesday, March 30th. You have two proclamations, Public Health Week and Hero, April Flood Awareness Month. Also from the Department of Economic Development, you have a request for public hearing for a proposed commercial property tax credit. The Department of Finance will have the Board of Education non-recurring costs, and the Department of Finance will have the FY 2022 recommended budget for your approval. Also, your weekly review from the Office of the County Attorney for legislative updates. For today's meeting, we begin with item 6B from the Department of Public Works and Transportation with the St. Andrews Landfill cover repair, SW 2101 budget amendment. John Diedrich presenting this morning. Good morning.
Good morning. I'd like to ask Mr. Serkin to come up and join me.
Morning, Ms. Dietrich.
All right. Appreciate you taking this one on, and Department of Finance hard work to try to find us the money to actually undertake this work. the St. Mary's County, St. Andrews Church Road landfill had landslides, sloughs after the tropical storm. The water apparently had gotten between the soil and turf cap and slipped down the membrane that actually encapsulates the closed landfill. Bad situation.
So it moved the membrane itself?
No.
Oh, it didn't remove, just the door off top of it?
Right.
Okay.
So I'll let Mr. Zirkin just give us kind of an update on what the potential contract that we can award to MES would actually accomplish.
Good morning. The contract from MES, the proposed contract, we actually have 2 erosion problems on Area B. One on the southern end, which is more severe. Larger portions of the ground cover actually moved down the slope. And the northern section of Area B has smaller ruts, erosion areas. MES plans to come in, remove the dirt, just move it on top of the landfill, and we'll spread it out later, and throw some rock down and some soil, and do a drainage improvement also to contain the water, let it run underneath properly. It's about $550,000. MDE has to approve the repair process, which MES, Maryland Environmental Services, has said that it shouldn't be a problem. And I've already contacted MES to go ahead and start the remediation or the repair.
So MES will do the work?
They oversee the work.
Okay.
They have their own,
But they'll
have
use their
their-
own
yes.
contractors?
correct.
Tell me, when you cover a landfill or cap a landfill, how long is that there? Is that like forever? I
Well,
mean, is it like
that's the
never
hope.
again to be used?
Yeah, that's
and-
the hope. I think it was capped in '01.
Okay, so it's been 20 years.
Right.
How long should it last? Like 100 years?
Well, it's at least 30.
Okay.
That's the federal guidelines for monitoring the gas from the landfill.
At what point do you get to use that property, or is it never usable again?
No, you can use the property, but it has to, certain guidelines the state has to okay. Like we attempted to use it for photocells, solar cells.
Right.
But there was a problem with actually the hookup between SMECO and the cells.
I know one time we talked about putting a sports complex there, but it
Sports
was like,
complex.
hey, look, we'd have to rip the top all the way off and.
Yeah,
you know,
something like
start-
that
I
you
mean,
can't
it-
do. Right, we have to keep the existing cover and,
But you can't put a field on top.
correct.
Okay.
But I did hear on the news, but I haven't researched it, that a landfill in Virginia, closed landfill, they're going to build a ski.
Well, remember, that's what Mount Trashmore is down at Virginia Beach.
Yeah.
Yeah.
It's simply a dump. They put a bunch of stuff on it. They have recreation, all kinds of stuff on top. So I don't quite understand if you can do down it, and everybody drives down what's 95 or 64, you can see Mount Trashmore, why we can't do something similar unless Maryland's got such egregious rules that, you know.
Well,
it
we
is-
do have to run it by the state. I know we were close with the photos for the solar cells.
Right.
But the only, like for instance, we couldn't anchor, we had to use a different type of floating cell for the landfill, excuse
Well,
me.
what's going to, you know, rain comes and rain goes. When you get a lot of it, there's going to be wash. So when you put the stone down, I mean, it would seem to me the stones might move faster in another huge rainstorm than dirt.
Well, they're
So-
going to also update the drainage area too, below this stone,
It
down
could-
at the bottom, to prevent the sliding, slippage.
But there's nothing you can do. I mean, a lot of people, you know, have trees on the side of their hills or brush, and the root structures hold things in place.
Oh, yeah, no, actually, when MES comes down, we do have some trees that grow up, smaller trees. They have me remove them so they don't penetrate the roots.
Because they'll go through the membrane, right? The roots.
I just don't understand why we couldn't put a field on there, though, where kids would play soccer or lacrosse or some kind of a sport that's not, like driving over it or anything.
I agree.
I mean,
I can further that and see the state guidelines.
again, it would make it easier if we were talking about this sports facility that we had a vision for, because we moved it down the road, but that's awfully expensive to start down there. But if we had an area that was already cleared, and then we had our water sewer right there to it, it just would be such a better usage. But I know we've asked about this before. Mr. Dietrich said you'd have to rip the whole cap off and start over, and that, obviously, don't want to do that. It just doesn't make sense that you can't play on top of it.
Right. You also would have to fill the space between, to level it, you couldn't drop it. You'd have to,
Raise it.
unless we move the trash somewhere else, I guess.
No, see, no, I don't want to get into all
Yeah,
that.
we'd have to
It's too
fill
hard.
between the mounds.
You just can't put a field on, you just can't plant grass on top and play
Well,
on top.
we do have vegetation there, on there.
But you can't step on it. That's a question.
No,
That's a good question.
You got grass planted on it now, some kind.
Yeah.
It's not like.
Correct. And we
Now-
mow it.
Now, next thing, this new construction you're going to do, are you putting some kind of like what they call a French drainage system underneath of it?
Yes.
So that the water will drain away?
Correct.
And it goes on through rather than washing it all off? Okay.
Will it end up in Johnson Pond like everything else? Seriously. I mean,
So-
everything goes that way, so,
Yeah, so hopefully this,
back to ground zero again with the Wildwood fiasco, Johnson Pond fiasco, here's fiasco, and, MDE
so
and MES.
so hopefully if we can stabilize this, then why can't we build on something on top of it? If we stabilize it with this French drainage system we're getting ready to put underneath there, or what I'm calling French drainage system, which is around most basements in the area, French drainage system, to take water away from the wall. Let's take water away from this mud and slide and whatever, and hopefully create a barrier to stop them from sliding. I don't see why we can't put enough cap on there to use it for some kind of a sports event or sports fields.
Yes, sir. Well, we
You'll
do
check
have
into
some
that, I'm
gas
sure.
lines underneath, too.
Gas lines underneath there?
Yeah. That
Gas
move the
line,
gas.
you mean the
Pipe, not it moves the gas to the flare. that we
methane?
let burn.
Yeah.
methane?
The methane gas coming from the trash.
Right.
Right.
And that
I think we
moves
worked on getting that solved some time ago, yeah. Or at least got most of it away
So,
from
Mr.
contaminated.
Dietrich, when the tropical storm came through that did all this damage, there was a couple weeks there where we were really scrambling a lot, you especially, to get a big list of all of the costs. This was probably not included in that list at the time?
We didn't have a firm price
Right.
to show to
FEMA?
MEMA or FEMA. And since that time, we've finally got the price a couple weeks ago. Gerald Gardner had already been talking to FEMA, MEMA for some time about the fact that this happened.
Okay.
And they gave us
So it isn't
some
something we
good
just
advice
discovered.
on how
We
to.
recognized it as a problem back in
Correct.
when it happened.
Right, so they knew the problem was out there. A part of the problem was because of the erosion happened, we couldn't mow it, we couldn't see what was going on, and it was also kind of dangerous to walk on. So finally, we were able to knock down enough of the brush, the tall grasses and so forth, we could actually get a much better idea of how much was erosion. A really critical part of the design of that drainage system are the ditches at the bottom. Effectively, what happened, the dirt washed down the hill, plugged the ditches, which didn't allow the drainage board, this cellular material that's between the soil and the actual cap, it didn't allow the water to go anywhere, which forced, so we're gonna have believe me, we will go very carefully over MES if you approve this motion, in order to make sure that we look to the future about possible reuse of the site, as well as make sure we minimize our ongoing maintenance issue. Part of that will be making sure the top actually drains off and there's no water ponding on top, that will work its way down into that soil. You know, we want it to sheet off, get down to those ditches and move on to the St. Mary's River, I guess. But we don't want this to happen
I
again.
think this is a really good example of how yesterday's trash will be paying for it for a long time into the future, even when you don't expect to be.
Gotta do something with it.
Yep.
So, Mr. Dietrich, and on that regard, you brought up a good point. And that is we're going to have to deal with MDE in the not too distant future on all this Tier 2 mitigation. So we're going to do this repair before it goes to Johnson Pond into the St. Mary's River. So are we going to be held to some different standard on Tier 2 displacement and mitigation when we're trying to do this, or are they going to cut some other kind of a deal on the side that this doesn't really apply?
We're not actually going to excavate beyond, and we're moving dirt around that's already there. I think, I don't know, Nick, if you've had a specific discussion with MES on that.
The dirt will be moved and just placed on top.
On top, right.
Right. And then we, the county, will level it out.
Right. So we're not actually creating any additional impervious area. We'll probably be required to use two layers of super silt fence, a number of things like that. But fortunately, our record with them has improved dramatically. FDR got approved, the FDR Phase 3 got approved this week.
Oh, good.
With the Tier 2 review, which is really good news. Well, Alan might mention that when we move to that property item for FDR. So, and we do have a conference call set up with the person that actually runs that whole operation to go through, where did this come from? How much of this is internal policy that suddenly got activated? Is there really any regulation behind it? We've got a whole series of questions for them that were in that were already in that letter that we sent up to Secretary Grumbles. So I hope we continue to make progress with them and impress on them the problems this is causing for us, much less the private development community. But we'll also look at the Wildwood project and say, what this is in the category, this is in the area, does that apply to that particular project, that process? I won't call it a regulation, I'll call it a process.
Well, I'll move to approve the budget amendment reducing the FIN 21 capital reserve by $585,000 and establish project SW 2101 St. Andrews landfill cover repair and authorize the Commissioner President to sign the related documents.
Second.
I have a first and second. All in favor? Aye. Any opposed? Ayes have it.
Thank you very much.
Thank you.
Thank you.
Thank you.
Thank you,
Yeah.
Commissioners. Items also from DPWT with the FY 2022 MDOT Transportation Priority Letter Transmittal. Mr. Diedrich.
Thank you. So this is the same, a letter that we put in every year, as you know. And this year, we met virtually, of course, with MDOT Planning up in Baltimore to discuss our priority letter and what we could do to make it more successful, because things aren't moving that fast. And the main advice they had was that they felt that our format that we developed 2 years ago, I believe, where we separate out the types of projects was effective. They liked that idea, but they also recommended that we focus on things that could actually be funded. And So that in particular applied to the Thomas Johnson Bridge project. So there's a breakout project that's listed there, which they thought could be successful, which is to extend the dual lanes all the way to the bridge through Patuxent Boulevard traffic signal. Right now, that's a major traffic bottleneck and safety issue, as you know, I'm sure. I'm sure you've been through it many, many, many times. So extend it all the way out. It's also a part of the bridge replacement, the conceptual design that was already done. And so it could kind of do two things. It would allow that merge to happen. It would include the cul-de-sacing of the local street that currently causes some traffic issues
Right
near
there
the
at the bridge, at the bottom, down at the bridge. You're talking about South Patuxent Beach Road?
Correct.
Right.
Yeah. So and I'll talk a little more about the projects, and you can certainly ask me any question you want to. This letter was coordinated with the town, and their main concern is just they want the sidewalk that actually is a major project for a major benefit to the county, because that would extend the sidewalk up to where the library and new Garvey Senior Activity Center is, because right now it's kind of a mess if you're trying to walk to that area. And it's a favorite walking location. It's a perfect thing. You get up, you have some place to go. When you get to the other end, read a book, take a book out, walk back, or go to the activity center. So that is an important project for all of us.
What page are you on? You're talking about?
All right, so it might be easiest if we just go to the letter itself. So on the first page of the draft letter, we've got the comments on the TJ Bridge, Route 4. When we talked to the planning people, we mentioned the idea of trying to focus on the intersection. They said definitely keep that in the works. And the way we've done that is we've filled out the Chapter 30 scoring for the project. I guess no one knows if the Chapter 30 scoring is actually going to mean anything in the future. It was brought out a couple years ago to supposedly help MDOT rank projects. Really hasn't done much or had much of an effect, but that is a way to keep them aware that we still want the bridge done and we want the intersection improved. So number one, so these first 4 items are really the key projects that really need to be done. And the Route 4 merge that I mentioned, the Route 5 project at Great Mills Road, there's absolutely no construction money in that at this point. That needs to continue to move on. They apply for grants instead of putting Maryland money into the project.
I thought our state delegate was going to have this intersection built for us.
Well, you can only put your energy in one spot at one time.
But we're talking about
Great Mills.
Great Mills, yeah, down there at the bottom of the hill.
Correct.
Well, we had rearranged that to be our main priority because TJ Bridge was unfundable. That was our
Correct.
recommendation there, Commissioner.
Yeah, and that's what we're.
What happened?
Sorry.
Didn't happen. I don't know.
I would recommend, in looking at this letter, Mr. Dietrich, that item number 4 be removed. Obviously, there's been tremendous discussion that I've been involved with not only Congressman Hoyer, but Mr. Slater and the whole MDOT staff. And the bridge repairs and replacement began last week.
Yeah, it's underway.
So really, completion repairs is really mock snicks at this point in time, since they've already started working on it heavily.
Okay.
Thank you.
Thank you.
We would anticipate they'll complete it if they started it, right?
I have a feeling that with the discussions that have been going on far above our levels, that this thing's going to get finished.
All right. And then the highway projects are listed are also important, but just not quite as important as that first group of projects. Definitely 249. We want to keep them focused on that.
There's another one that their delegate thought he was going to fix for us, wasn't that true? That's in your district, right?
Oh, yeah. Just backing up real quick to number 3 in the previous section.
Okay.
So what we're asking for here is to turn Route 5 into a 4-lane road going all the way up to Muldier. Is that correct?
What this actually is we want them to look at it and see what needs to be done. The problems of the intersection of Medley's Neck and 5 were very much in the news. The problems, the interrelationship of the schools that are there, and that intersection is a particular problem. It could include, as we say, a 4-lane road with bike and pedestrian facilities, or not.
I'm pretty sure we had them look at that intersection already, and they came back when that 7-Eleven was even being discussed and said it's not a problem. But I disagree, but that's...
What they said was that the traffic signal didn't need any modification, and they felt that the 7-Eleven could go in with, if they followed the access that SHA gave them, the type of access into the site, which of course both sides of the site are on a state road. If they followed that, the state felt the 7-Eleven could work there. Many people disagreed with that. I'll leave it at that.
That's all. I just wanted clarification.
But there's some severe problems there. The people in the subdivision can't get out when the traffic backs up, which is every day, which would also include making left turns out of there. There's just a whole series of things that focus on a couple of the intersections.
Right.
And the wording for this, the town wants the idea of this to stay in the focus of SHA, because they know that it's part of the development, the Leonardtown Development District, and so it's targeted for development, but we need to do it in a way that's responsible, and we need the state's partnership in that.
What about the partnership of the town of Leonardtown? I often wonder. I remember 4 years ago when we were looking at this library site, and I walked Leonardtown, and sidewalks looked like they could use some upkeep and some upgrade, and the roads back there in Lawrence, and look like. What is their commitment to capital projects? I haven't seen any that I know of. How come they're not putting a sidewalk out here to the library in the Garvey Center?
Well, it's a state facility. The state would actually have to manage the project.
Because it's on 245.
It's SHA, it's 245.
Yeah. I just don't see a lot out of Leonardtown as far as capital.
Well, they could apply for transportation enhancement money, and which is what we applied for on one of the other projects here, which is MD4 from Wildwood Parkway, adding the side path from.
They ever partner with us on these proposals?
I guess I would leave that up to you all. We're perfectly willing to work with them, and we already worked out the stormwater problems that were in the initial plan for the sidewalks, where the state had originally planned to impinge on Parks and Recs, Recs and Parks soccer fields to build a stormwater facility. Don Mills found a better place. The state agreed with it. And at that point, the project stalled out because the construction money wasn't put in it. So right now, it's a state project. It's just waiting for the construction money.
Funded.
Correct.
I mean, to be clear, if we're talking about the sidewalks and other projects and the CIP and, you know, beyond the state roads, you know, I think that's what Commissioner Hewitt was getting back. Those are municipal roads that need improvement. So on that side of where is their CIP stand? But, you know, if the sidewalks are a priority and the state is, well, they've been pretty good so far about the sidewalks. They did the projects out there. But the state's saying, no, there are other paths that the town could take to do that work. You know, very, very simply put, it's communicating with MDOT that they want to do the project, and then they become the primary on it. I've seen it done plenty of times. I've led one or two of those projects, and the other side is, you know, they can basically look at the GIS and see the scope of where it lays, and then they can take over maintenance of that roadway, of that sidewalk. So it's basically a letter that says we're going to take over maintenance of this swath of land, and here are the coordinates, and now that's how we're going to do it. Same idea as a roadway. You know, let's say Hollywood Road. They want to take deed to that road, or they wanted to do anything, it's a roadway transfer, or they can take deed and take over maintenance. So there's different ways. Of course, doing that then puts the burden of the capital project into their budget. So that's normally the prohibiting factor. But projects can be done. And the other side of that is when the state has the project available, if the funding's not there, they can do the MOU that says we're going to fund the project, but the state's going to use their contractors. So that's where the money comes from. So they can do it that way. Sure. It's been done several times. So, you know, and it also goes to the county level as well. So there's ways to get it done should that direction want to happen, either way.
So 249, 243, you know, the two really important projects to maintain access to large populations of the county.
Are we facing any deadlines on that McIntosh Run funding or whatever we were looking for over there? Because I got an email from Mr. Canassi saying that we have a deadline approaching and maybe we're not ready for it. Do you know?
Well, what we applied for was, as the department and you approved, is a grant under that program to do Bayside, which is the alternative road to 243 to get out of Compton.
That's over there by Criers, back road.
Bayview, Bayside. I get them confused.
Yeah, I get you.
But at any rate, the county road, there is a county road alternative to 243 when that floods. It's a long way around. It's definitely not a good idea for emergency services to have to go that way. And it's an inconvenience to the residents if they want to go shopping or go to work or whatever, when 243 is flooded. So, but again, when we met with the MDOT people and the SHA people who are responsible for that roadway, it was disturbing that they didn't seem to be aware of the severity of the problem.
Right.
And
That's the same thing
through the letter that the commission president sent, I think that, you know, and then our follow-up calls, and now the Silver Jackets coming in, I hope.
Yeah. Have we figured out a way to fund them?
that's moving forward as far as I know. For details on that, you'd have to talk to Mr. Gardner or Mr. Walker.
Okay.
But we had an excellent teleconference with the Corps of Engineers, just a whole group of people. And so they're actually putting together the application for us. And I mean, I'm looking forward to having that progress, because that'll give us a much better look at the whole McIntosh Run system, the whole drainage system. You know, what effect did the blowout of that beaver dam on Secretariat Drive really have on the tropical storm and so forth? So at any rate, I think we've got a lot of things in motion. Also, the monitoring device for the water, the flow of McIntosh Run at the bridge, you know, that's moving ahead with emergency services. Again, you'd have to talk to them about the specific schedule, but I think there are a lot of things going forward, but we've really got to keep MDOT's eye on that problem, or they're going to forget about it.
I agree.
And I think the photographs of the silting that took place at the bridge were important. McIntosh Run, where it dumps into the bay there at Leonardtown Wharf, is severely silted up from the tropical storm and the follow-up storms. A lot of new white sand in that location. So there are definitely issues, and the whole process that what they proposed in that teleconference of measuring the amount of siltation, where it is, the flows, the biology, you know, what's growing there, is all really important things, and I think we're going to make some progress on that. I'm encouraged.
Progress is a good word. Thank you.
So, are there questions on any of the others of the projects that are in the priority letter?
Yeah, I have one on, I think it's under highway projects, where it says trails, bikeways.
Yes.
I'd like to see something to add on to there. I think we already discussed this once, and they sort of threw it out, but when they did the new bridge on 234 across St. Clemens Creek, they put
Right.
no walkway whatsoever across there, even though you have wide shoulders on both sides, you know, front and back of the bridge. And I think we'd ask for something about some kind of a extension on one side of the bridge only for a walkway, bikeway, like the one on Route 6 in La Plata in Charles County, that they've got one there.
We can add that to that first paragraph. So,
Number 5, trails and bikeways. I'd like to see that added to continue pushing them to do something. It's heavily used down in that area. People don't understand how many bikes come down through there during the spring and summer, and they have no other choice but to go out on the road to cross that bridge.
Oh, the Lycra crowd. Yeah.
Yeah.
I've seen whole swarms of
Yeah, it comes through there. I mean, there'll be dozens of them come through at a time, and it's pretty prominent during the summertime. They ride that 234 and 243, all those roads through there. They have a shoulder especially, and we got the shoulder there, but the bridge has nothing. They just built this new bridge and put no shoulder whatsoever. Plus, it's a danger of walking across there like I do quite a bit.
Yeah, and there's examples of that in Charles County on 6.
Yeah, Charles County, like Route 6 right there, just
Right.
just south of La Plata. They've got extended a walkway, bikeway right next to the bridge. And I don't see why we can't do something very similar down along there.
Yes,
All right.
that would be add a side path bridge to the
Route 234
roadway
across the St.
bridge
Clemens Creek.
for
St. Clemens Creek.
234.
I move to approve the FY 2022 MDOT
that's
Transportation Priority Letter as amended, and authorize the Commissioner President to sign the St. Mary's County MDOT Transportation Priorities Letter and transmit to the Maryland Department of Transportation Secretary Slater.
Second.
Do we have to put in there with the amendments we just gave them?
He said that.
You just did.
No. We have that covered.
Okay,
Thank you.
good, very good, okay. Okay, I have a first and second.
Aye.
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 Any opposed? Ayes have it.
Thank you very much.
Thank you.
Mr. Dietrich, I see you'll probably be ready to talk about bus stops and STS signs and everything in the next agenda item, right?
Yes, sir. And I believe Ms. Swint is with us.
Commissioners, item D is also from DPWT with FY 2022 St. Mary's Transit System Annual Transportation Plan Grant Application. Mr. Dietrich's presenting, and Allison Swint, Deputy Director for Transportation as well.
Welcome.
Good morning. Thank you. All right. So again, this is another one of those yearly events where the department puts together the grant application with a lot of information up to MTA for that annual grant, which includes both operating and capital. And yes, one of those attachments, C7, is the capital, the capital grant request, which is buried in here somewhere.
You're talking about for the sidewalks?
Yeah, so Ms. Swin can go through that.
It's in
Do you
part
want this?
2.
Do you want that
B.
back?
Well, if you want to start from the top, because I had questions from the beginning. However you want to proceed.
Let's start with your questions, sir.
Oh, no, that's
Oh,
not
no.
fair. You may answer them in your presentation.
Okay, all right. So some things have changed, some things have not changed. The money that we are requesting from MTA is roughly about the same. For the operating, what has changed, we continue to use the CARES funds and will continue to use the CARE funds until that pot runs dry, at which point we will then use the county operating funds, intending to return the federal and the state portions that were awarded under fiscal year '21. In a quarterly meeting with MTA last week, they mentioned we can expect to receive the second half of the CARES money, the STS CARES money, in approximately 4 to 6 weeks. So we will cover all of fiscal year '21 with the the CARES money.
How much do you think you're talking about?
2-point-something million.
Okay, that's this big number we're looking at.
No, it's not included in this. We did the CARES grant a few months ago when that was awarded.
Good. Can that be used for bus stops?
It's for everything operating. We are not supposed to be using the capital or anything capital under the CARES money.
Right.
But we did have, and we were awarded bus stop money in fiscal year '21.
It doesn't look like we're only getting 2.
Bus stops?
Well, okay, you go ahead with your, I read this thing a couple times over the weekend because I was really interested in it.
Okay,
I got a bunch of red spots here for you.
okay, I'm ready. I'll be ready.
Right.
So then for fiscal year '22, this upcoming fiscal year in the capital, we are requesting 2 vehicle replacements, additional bus stop signs, as well as shelters that were outlined in the MPO study. We are requesting a trailer for our bus drivers as a break room because our building is simply just not large enough. And then we're also requesting preventative maintenance, which is an ongoing item that we request annually.
So when we request new vehicles, have we looked at, I know the Sierra Club has reached out to all of us frequently about getting electric vehicles and converting to an electric fleet. Is that something we've looked at cost effectively? Would it make sense?
We are looking at it.
Would the state support that?
We continue to look at it. So 2 problems that I identify immediately is setting up the infrastructure behind it and making sure that we have those charging stations in place, as well as the mechanics to work on it and those types of things. The second is for the size buses that we are currently using, the battery life of those currently doesn't support our operations. So at this point, I don't think it's feasible for us. However, in the future, as those battery lives are longer and they're more developed, we will certainly look at purchasing them then and going towards Go Green.
Good to know.
Yeah, I am going to listen in on a webinar that's either this week or next week
Right.
on the state's progress towards not just buses, but trucks, electrical truck, what it would take to put those type of vehicles on the road. Down here, it's very difficult. As Ms. Swint mentioned, there's no charge, we're starting to build charging stations, but nothing really to support commercial vehicles. Conceivably, at some time in the future, if hydrogen became a more reliable fuel source for buses, and it was somehow incorporated into the smaller size buses that we tend to use here, then we could go forward with that. Same with the cutaway buses, what we call cutaway buses. If they actually come up with a viable form, I guess, and an affordable one, we would definitely look into that, because we would like to move more and more towards reducing our carbon footprint of the transit system.
Do they have any kind of hybrid type of vehicles, or buses and trucks that we can look at?
Prius bus?
No, if you got a Prius bus, but we've been a Prius family since 2008. It's worked out pretty damn good. Anytime you get 60, 70 miles to the gallon on a vehicle, it's hybrid, but the gasoline doesn't run all the time. And
Right.
so
Again,
I don't know if there's any kind of bigger vehicle out there like that that's hybrid that would work. I don't know.
the large hybrid buses like you see up in D.C. Have been a real maintenance problem for them. They can reduce the fuel consumption, but having to run air conditioning in the summer and heat in the winter.
It's a pool on the battery,
Yeah.
or whatever good the batteries are with the lithium,
Right.
storage capacity.
Well, it just seemed like
Right.
you'd have, once they're running though, you'd have something charging them, generator, alternator, recharging the battery. But it's an interesting concept, I mean.
Yeah.
Commissioner Morgan, if you can talk to your buddy Elon Musk and get him working on this.
I got one share of Tesla, so I'll show up at the shareholder meeting and talk to him about it.
Good. Bring it up.
Well, the present Prius we have does have all that in place. It's got not only the four-cylinder gas engine, but it's got alternators inside the front wheels. It's got the whole top of the roof is a solar deck. I don't know. It's kind of interesting that even back in 2014 they had
Yeah,
developed
and I think there's definitely going to be something that we can use in the future. Right
Yeah,
now,
I'm just wondering
it's
if
still kind of
they've gotten into the
experimental.
bus. But if they're having a problem with them right now, then we sort of don't want to get into that either.
Yeah, and we'll definitely look at everything that's available
I understand.
when they Continental.
That is something we could potentially look at for the county fleet of vehicles where there is
Sure.
proven technology.
Sure.
Just if it's cost effective to look into.
I know there's a lot of, just reading some, like, for example, Salt Lake City has got to go totally electric within the next 15 years. Every vehicle is going to be electric going into Salt Lake City because they have such a huge smog problem there, just for example. I know they've already done that with their buses and their rails, and everything is all gone electric already.
Well, particularly if we can get solar at the landfill, which is directly, proximate to our STS bus garage, it could be, it could be a great, alternative.
They want a soccer field there. We can't
Not
put.
where the buses are. A bus barn there. They definitely can't put that on top of the landfill.
That's true.
Well, they're very close, obviously, so I think the future is open there, and that's why Ms. Swint and I continue to watch the webinars, even though some of them seem pretty pie in the sky at this point. We continue to watch them and
That's an
try to
understatement.
see what's out there.
Appreciate it.
You got a dream.
Yeah, well.
Here in Maryland and California.
Hey, Commissioners, any more questions?
Well, all right, are we ready for questions now?
I'm ready for questions.
Tell me about your attendance at your roster for your Transportation Advisory Committee. It looks like you had to cancel your last meeting for lack of a quorum.
Yes, so
Is there an issue going on there or something?
it's a work in progress. There's been some transition with staff, and I
at this point, believe that the staff was doing duties that the Transportation Advisory Committee should have been doing, essentially the chair notifying and reminding of meetings, things of that nature. They were unaware because previous staff had been doing duties that weren't necessarily their responsibility, so we're working through it. They had one resignation. They're currently down to 3 members. So we are working with Diane Gleisner and...
Good. So you're working to get it fixed?
Correct,
Because I
yes.
did see here where it said, the committee will work to assist with the implementation of a bus stop study to include the first stops being along Great Mills Road. But you need a quorum to start that.
Correct.
Okay.
Correct.
Now, I also went back to what I thought was a chart that talked about the cost of running these buses. And it sounds like the running the buses is at a negative as far as revenues are concerned, as far as passengers paying for.
Yes.
Okay. And that negative is made up from the state or the feds through transportation grants? How are we covering that negative?
So the negative is primarily due to COVID and where our buses are capped at a 50% capacity.
Okay.
So we cannot accept
Makes
the full
sense.
ridership. Right. So everyone across the state is having the same problem because all of the buses are capped.
Okay, yeah, that makes sense. All right, so it should be better, though, when,
Yes,
Get back at
yes.
it.
So as the restrictions lessen and we are able to increase ridership and, yes, to answer your question, yes.
you had some buses here that were kind of interesting with their mileage. Something like 619,000 miles, 453,000, 421,000, 419,000. I'm hoping those are American-made buses because Lord knows we make good stuff. But, and then looking at the condition, those ones are out of service, I would assume.
Probably. You may have, is the form that you're looking at the 6A?
Oh, what am I looking at here? Well, whatever was in my book here.
That may be the 6A. That has buses that have already been disposed of, as well as the one that are currently in service.
So that's what you're doing with these new buses that you're ordering. They're kind of replacing some of these
Correct.
ones. Because you also have many of them in 100, 200, 300,000. Seems like they need a lot of work, right? I mean,
Yes.
you have mechanics, you have people that, they're not mechanics anymore. They were when I was doing it, but now they're technicians. But do you have people to, because I know you have some in your budget, and I'm not sure we're recommending them, but it sounds like if your fleet is aging, you may need them.
Yeah, so our vehicle maintenance is covered, well, our STS vehicle maintenance is covered under our county vehicle maintenance.
Okay, so it's county money then? Okay.
Yes,
Okay.
and then we do, STS does pay for all of the parts and whatnot that go into the buses, and that's part of the preventative maintenance. So if a transmission goes, wheelchair lift, anything costly, an engine needs to be replaced, that will come out of the preventative maintenance that we're requesting from the
But
capital
again,
budget.
you get the people to do it?
Yeah, we do, yes.
Okay. Now, towards the back, under Section B, you talk about bus stops and bus stop shelters and break rooms and
Yes.
things like that. And it says, are there any risk addressed by these projects, and there are none with the bus stops or the...
No, the stops are primarily to increase the safety, so we have designated stops that motorists can identify, and they'll understand why a bus is coming to a stop in the middle of the road.
Okay. And I thank you for your chart here on what 1, 2, 3, 4, 5 men as far as the quality of the equipment, because one is definitely bad. Now, you also talked about needing a trailer
Yes.
for bus drivers, and I thought I saw it in there around $93,000. Seems like a lot of money for a trailer for a break room. I mean, I'm not trying to say it's too much, it just struck me as that way. What's this, I mean, when bus drivers do their routes, do they eventually come back to St. Andrews Church Road and say, I'm going to take a break here and get off the bus and go somewhere and take 30 minutes? And
Sometimes,
is that how it works?
sometimes.
How would this trailer be used?
So the trailer is essentially a double-wide trailer that provides for meeting space, it provides for some office space, it would provide for locker space, all those things where they can keep some personal items.
Oh, okay.
They can have meetings, they can do some training. things like that. So it's not just specifically for a break room. I don't want you to think, just couches and recliners, because that's not the idea.
Okay, so it would be maybe a place that they would report to, have their own area where they could store their personal stuff if they needed to while they're on the bus. 'Cause
Correct.
who's reached out to me is people who are hourly bus drivers for our STS. I'm sure you probably know, because I'm sure she's talked to you like she's talked to me.
Yes.
And the point is that they continue to say that their hourly rate is below Calvert, below Charles. How are we doing with that? Are we doing any better with our hourly people as far as wages are concerned?
So we're working on it. Currently working with the HR department and trying to transition more of the hourly positions to full-time, but then also working ahead of the minimum hour or minimum wage increase,
Right.
so that we can provide those increases to our drivers before the requirement to increase the minimum wage.
Because what I've heard is that it's affecting their morale and also the ability to retain and attract and retain, hourly bus drivers.
Correct.
Now, it talked here further back in that same section about your bus stops. And it said, STS will partner with Charles County, all about piggybacking, sounds like a great idea, to install bus shelters within St. Mary's County. Per the MPO study, it was recommended 9 additional shelters will be installed within the next 5 years.
Correct.
Why so long?
It was written within the study. I don't know, based on when I became involved with STS. I could speculate that they are just allowing for the time for it to be inputted into, for example, we have them in the fiscal year '22, so to budget and get the approval and put them in and implement.
Hopefully it'll be faster in 5 years. But I do like the idea, each shelter includes a bench, a solar lighting, and STS will strive for additional, some kind of cameras. I mean, would you consider cameras at the bus stops?
Where possible, yes.
Yeah, I mean, I think that doesn't sound like a bad idea.
So before you move off of the bus stops, can I ask a question?
Yeah, go
or
ahead.
two? So just looking at this, it looks like under $15,000, $14,000 for bus stops, and that's for 2 bus stops. So we're talking, and of that, under $13,000 is Fed state money. So if we wanted to speed up this process, could we fund all 9 bus stops in the next year to make this happen?
And then get the money back? I'm sorry to jump
Well,
in.
yeah, even get the money back, that's even better, but we're not talking about a.
I'm not sure that we can, right, I'm not sure that we can get the money back once we do something. We have to get the money or approval for the money before we do it. It doesn't retro. But yes, one of the, conceptually, I'd like to plan, so the money that has been allocated by the county for county funds for STS that we are not going to use because we're going to use the CARES money instead, all of that money would be at our discretion to be able to purchase and input all of the bus stop shelters, the bus stop signs.
Talking about it for a long time, and it seems like
Right.
in the grand scheme of things, a relatively small amount of money could get this done and knocked out.
Correct.
And then we talked about bus stops in the letter that we just approved. The plan for the bus stops, is it for them to be right off of the main road, or are we looking at potentially pulling into shopping centers and having an MOU with the bus stop there so that the bus is then off the main road, not impacting traffic, a little bit safer, but still walkable close?
Most of them are right off the roads.
Okay.
But we do have agreements with certain shopping centers already. The one at Food Lion up in Charlotte Hall is, I think, the only one that I know of that has a bench right now.
I mean, you need one at Walmart, you need all these places that are really popular.
Right.
But tell me, it says in here that you're working on bus stop signs. Great idea. So you can reduce flag stops.
Correct.
But you're still doing those flag stops.
As of now, yes. Yes. So the good news is we also just got our permit for Great Mills Road to be able to install our signs. So we're making progress on that now.
Well, that's the other part, because SHA is also part of us doing these bus stops, I'm sure. So when we want to request a sign, we need their permission?
To put the sign in their right-of-way, yes.
Yeah.
So some of this delay is
And- or
because a lot of
bus
it's on
shelter.
state property.
What's that now?
Some of the delay is because it's on state property.
Oh, it's
That's
on
where-
state
State
property.
roadway.
Got it.
That's where if we could just, the the old McKay Shopping Center where the food bank is, if we could have the bus stop in the shopping center versus
Yeah.
right off the road. And-
Sure.
Yeah, you don't want to drop them by the road and have them have to walk, especially if the weather's poor.
So let me ask this question. If you're going to have X number of bus stops and still have flag stops, somebody can have a bus stop and it could be 50 yards down the street, and somebody could flag them because they don't walk the 50 yards.
Yes.
Is that correct?
Once the bus stops are in place, the flag stop should cease to exist, because at that point, we have the designated stop. So right now, we have an approximate location, and if they're near to that location, it's considered a stop. If they flag them down, we'll pick them up. We won't drop them off except at a designated stop, but we'll pick them up.
You'll pick them up even if the bus stop's 100 yards down the road and they don't want to walk.
Correct.
Why?
Customer service.
Customer service, that's our rules right now, I reckon, huh?
Right.
Well,
So, but once we have the bus stops marking the specific location, we will no longer pick them up because they don't want to walk the 100 yards.
Right. One thing that's discussed previously with me was that if we get a whole roadway section like 246 from 235 to 5 with bus stops actually on it, then we could come back to you and eliminate flag stops if we have a whole segment in a certain route. And so that's definitely a possibility.
Well, why do you have to come back to us to eliminate flag stops? I mean, that's more of an operational thing. I mean, that doesn't make sense to me. If you have the signs up, why would it need commissioner direction for you to stop flag stops? You already have permission to put the signs up.
I don't know, I think it's probably a good thing, because it's a pretty big shift in the way you've operated since its existence.
We may have to actually have a hearing on it, and that's something we haven't pursued. But MTA may require us to have a
We
hearing.
have to investigate that,
The
right?
total culture
An
shift in how
operational
our
change.
buses
But
would
public
work.
awareness would be, I think, would be the ticket, because these flag stops are not safe. You know, for these people just to be there, and, I mean, I think we've already had an incident where,
We had a fatality.
and Lord knows, we want to avoid that. So the key, I guess, is to say, we're going with these bus stops, here they are, this is what they look like, here's your sign. Be there. What I also liked, I saw you had your chart in here of when the buses come and the schedule, that's the term. That's the term.
Yes.
And I'm assuming those would be on every bus stop. So if someone were to go there, they would say, okay, the bus is going to be here in 10 minutes or something like that.
Right.
Yeah. Well, and then lastly, your preventive maintenance budget, you talk about $200,000, it's towards the back, and it's right there before C. And the point is, it's the same for every year, 23, 24, 25, 26. You expect that to stay flat? With the new buses will make up for the maintenance on the old buses, because you won't do as much maintenance on the new ones, so you think that's a pretty accurate figure throughout the...
Well, I think that this was initiated because we had so many buses with so many additional miles
You're right.
still in place.
Right.
We just received 7 new buses, and we now seem to be on schedule with our requests moving forward.
How many total buses do we have?
22, I
So we
think.
got a third of the fleet.
Oh, the 7 new made up the 22.
That's what I'm saying, a third of the fleet's new?
Yes.
Well, good, congratulations.
Thank you.
Okay, that was it for me.
So there's 2 things. I know we had previously discussed the stop at the CBOC, and it was brought up that they're not fully operational now because of COVID and various other reasons. However, what I don't want to do is have the same situation where it takes forever to get a bus stop up, and they are operational. So I'd like to see a stop or route being planned for the CBOC. Whether it's stopping on the road or it's pulling in and stopping. So I'd like to see that. Additionally, I asked, I think 2 years ago, for the Food Lion bus stop in the north end to be moved to the roadway. Reasons are there's lots of complaints about vagrants people using drugs there, the proximity to the liquor store, and, the people not feeling safe going to Food Lion if there's not a presence right there. So I know there was conversations, I never had follow-up on that, but I would still like that bus stop moved out to Triangle Drive, so it's away from the immediate entrances of Food Lion and that shopping center. I mean, it's less than 200 feet to the Food Lion. Moving it to the roadway actually puts you closer to the AutoZone and the drugstore and various other things anyway, so it's more centrally located. And it'll give everybody a little bit of peace of mind when they're patronizing the Food Lion and other places, so they don't have to deal with
The
that.
same argument they had with the Weiss Market down 249 a number of years ago.
Yeah. I mean, so that I would like to see that one moved, or some traction on that.
And where are we at with an app for the phone that ties in with the bus system?
That's tied in with the routing software. Currently working on that package. I received some feedback from procurement, so I'm working to include those comments and suggestions from procurement. I will then send back out to both procurement and MTA for feedback and continue until it's on procurement's calendar for open for bid.
Excellent.
So there's actually progress now.
Yes.
Okay, because we've been talking about it for 5 years, so I'm glad you're
Yes.
moving it forward, and it'll hopefully be off procurement's desk.
I'm
We'll get that.
slowly trying to kick several cans down the road. Yes.
Also, when you're working with this bus to the CBOC, especially when it's Charlotte Hall, Calvert County is already running one to Charlotte Hall now. So just sort of coordinate the timing if you could with that,
Yeah.
that bus schedule,
Yeah, that's,
just to let you know.
Sure. Thank you.
You did get comments back from MTA on the routing software?
I have not, but I did remind them when I spoke to them at our quarterly meeting last week.
Okay.
So I told them, at this point, because I'm including procurement's comments, I'm not concerned with MTA. I'm just going to send it to both of them at the same time and
Okay.
continue to ping MTA at that
Okay.
point.
Good.
I'm going to move to approve the FY 2022 St. Mary's Transit System Annual Transportation Grant application to the Maryland Transit Administration in the amount of $2,672,816 for operating the capital programs and authorize the department director to submit ATP electronically consistent with the reviewed documents reviewed by the commissioners of St. Mary's County and authorize the commissioner president to sign any related documents.
Second.
I have a first and a second. All in favor? Aye. Any opposed? Ayes have it.
Thank you very much.
Thank you all very much for your presentation. Very good.
Thank you.
Thank you.
Man,
Thank
it must
you,
be
Commissioners.
DPW day.
Item E is also from DPWT with FDR Phase 3A with Marie Ann Gerard option contract. Mr. Dietrich presenting.
And Mr. Settle will join us here.
Morning, Commissioners.
Morning.
Morning. Charles?
All right.
Before you, Mr. Diasari, before you get started, I just wanted to say outstanding job to Allison down at the airport and your team, as well as economic development. I meant to say before I got sidetracked, but amazing job. Great comments from everybody, and to include the transit system, so thank you very much.
Thank you. All right, well, this is a fairly small piece of property, but it's very important, just like all of them. Mr. Settle will give us an update on where we are with the property and how that affects the bidding process, just where we are with that. But, so this, as I mentioned earlier, we did get the Tier 2 clearance. There's still another piece of paper that has to be done with MDE, but that we're greatly concerned about that. But Mr. Settle, could you please give us some background on where we are with the property acquisition for 3A?
Yeah, Phase 3A of FDR, which is from Maryland 237 Chancellor's Run Road to Buck Hewitt Road. We have all the contracts signed. If this contract today is signed for the Gerard property, except for one property owner. And that property, we expect to have a contract in place hopefully by the end of April. So Phase 3A property acquisition-wise, we're looking good, so we're almost there, finally.
Hold on that topic
yes.
for a second. It says here you get 24 to 27. Are you not
Yeah,
saying you get
the
26?
final owner owns 3 parcels.
Oh, okay,
So
okay. So
when
that
we-
final one will fix it?
Yes, yes. So-
And how's that negotiation? Are they cooperative? Are they
Yes, the final
answering our
negotiations-
letters?
Yes, then we've gone back and forth a few times. Our county attorney's office and Joe Densford's office are working with them, and we're hoping to have a signed option back from them, hopefully within the next several weeks, and hopefully have it in front of you for final approval on the option contract. So,
Well, that is good news. I mean, I always thought when your
Yep.
predecessor, George Erickson, used to sit here and say, oh, we'll get this done in 6 months. He's been gone, what, 2 years now? Lord knows, that procurement part, getting the properties acquired. Now, you haven't even started on B, though, have you?
well, Phase 3B, yes, we have. We've acquired recently, well, a contract recently came in, signed, ready to go for one of the property owners, from one of the property owners. We're also working with Smeco, who has a couple of properties down by the substation by Peg Road. So we're working with Smeco there. Several of the contracts now are being sent out by SHA, Office of Real Estate. So they're working with some of the owners now, trying to acquire those. So we're going to, eventually collect all of those as well. And we're looking at the spring of next year for completion for Phase 3B property acquisition.
Really? Wow. So 1 year from now?
Yeah, in the spring of next
I'll
year.
remember that. Well, that's,
Okay.
this
Yep.
is kind of, this is
Yeah.
the spring. So tell me, I was by on Chancellor's Run Road yesterday, and I saw that at the entrance there of Chancellor's Run and that fire department lane where 3A is going to start,
Yes.
that there was a trailer that's been removed, thank God, right there. And there's a white house I know that we're going to be tearing down.
Yes.
But when they left the trailer, I'm sure we weren't involved in moving the trailer, because there's a lot of debris left behind. Now, will that be something we clean up? Because it looks like the Dickens as we,
Well, I think what we'll do is we're going to work with the property owner there.
but we've already purchased the property.
We own where the house is, where the trailer was. We were purchasing about half of where the trailer was,
Oh, okay.
property-wise.
So he may still be on his.
So the trailer was pulled out, so that remaining property is still owned by that property owner, but we have about half of it in there, so where the house is
So
located.
the trash may be on his half.
Half, yes.
Okay.
Now,
thank you.
and with that in mind, with that house, we're working with the Bay District Fire Department for a training opportunity
burn?
for them. They will not do a burn of the house because it's so close to 237.
Oh, okay.
And also the power lines that are fairly close above, but they will be working on some training for attic training, wall training, going through walls.
Good.
Ventilation training, they called it. So we're having them, once they finish their training by the end of May, then we'll be coming in to remove the house.
So we'll get rid of the eyesore.
Yes.
Good.
So yeah, we're almost there on Phase 3A. 3B, we're, like I said, spring of next year. SHA is working on them right now. So we hope to be there. The biggest hurdle really with the properties are the lien releases. We get the option contract signed, ready to go.
Then you find out there's a mortgage.
So then there's a mortgage, if there's a mortgage on most of the properties.
Yeah.
But we're working through it. That's what's caused a little bit of delay, but we've got help from our county attorney and Joe Densford's office trying to get to those banks and trying to get those releases, so.
Gotcha.
Yeah. So with property acquisition, what follows then is utility relocations. We're looking at performing utility relocations beginning in May. So this will occur at basically 3 locations along Phase 3A, so that will occur. We've got Smeco, Verizon, Atlantic Broadband, we have purchase orders already issued for them. And then Washington Gas, within the railroad right-of-way, we're relocating about 2,300 linear feet of 6-inch gas main within the railroad right-of-way to shift from within the road section over to underneath our asphalt trail section. So this way, if any work had to be done in the future, it'll be moved over. And actually where it was located now, didn't have enough coverage. If we had to come in and build this road, the gas main had to be relocated. So that's going to be at Washington Gas expense, according to the easement agreement that we have with them.
Good.
So they'll be working on that hopefully May and June of this year, shifting it over. And then with plan permits for the project, where we are with that, we've received a non-tidal wetlands permit in the summer of 2020, soil conservation district approval, November of 2020. In the last 3 weeks, state highway access permit was just issued for the Maryland 237 intersection. And then also, as John mentioned, the NOI general permit, the letter of authorization was just provided yesterday for the NOI. We will provide the anti-degradation checklist to them as requested, but we have the letter of authorization in our hands, so that's good news. And then what we're looking, yes. Yes, so that worked out. Basically, final PS&E plan specs and estimate, we're looking at the end of March. And then by solicitation documents for Phase 3A to be submitted to procurement in mid-April. And then that includes the joint solicitation with Metcom for their new water main going in as well in different locations. We look at advertising the project from the months of June through July 15th, award the project by mid-September, and notice to proceed roughly in October of 2021. So that's where we are time-wise with the project, permits, and utility relocations.
So this will get us to Hewitt Road.
This will
No
get us to
relation.
Buck Hewitt.
No relation.
Yeah. I believe it used to be called Hewitt Road back in the day.
Anyway,
Yeah.
good. I had one question for you. The intersection there where it goes to FDR Boulevard's continued, it doesn't line up with Fire Department Lane, and I'm assuming you'll move that over when it comes time.
Yes.
Because what they do now, they have a light for people coming out of Fire Department Lane that's different from the light. Will that all be synchronized when will it all be lined up?
Yes. What will take place under this SHA access permit includes 2 traffic signals. One, a temporary signal where we have to do a shift, put the pole in. We're actually constructing the right side of the road where the house is located.
Right.
That'll be constructed with a temporary signal. Then we also have an ultimate signal design, and that's when everything shifts. All the signal heads move, cameras shift.
Wow.
So then we have the ultimate design. So there's 2 plans actually for that traffic signal at Maryland 237.
That might be filed up for a while.
Well, we'll make sure everything is safe though.
Okay, good.
Yeah.
Thank you.
Anything else, Commissioners?
Move to approve the option contract between Maria and Gerard and the Commission of St. Mary's County for easement acquisition needed for constructing the FDR Boulevard Phase 3A project and authorize the Commission President to sign all related documents.
Second.
I have a first and second, all in favor?
Aye.
Aye. Any opposed? Ayes have it.
Thank you very much.
Thank you, Mr. Dietrich. Thank you.
Thank you, Commissioners. And item F is from the Department of Finance with the resolution authorizing the sale and issuance of $30 million bond, general obligation bonds. Jeanette Cudmore, CFO, presenting this morning. Good morning.
Good morning, Ms. Cudmore.
Commissioners,
Good morning.
we've been making progress on our bonds. We've been working with our bond counsel and investment advisor on the timeline, the public offering statement and the credit presentation, agency presentation. We're working on that also through February and March. And the actual presentations to the rating agencies are planned for April 14th and 15th. Based on the updated financing plan prepared by our financial advisor, Y River, the estimated all-inclusive interest rate is currently at 1.83%. I had them update this last week because we had gotten an earlier estimate back in February, and it was about 1.46%. So it's gone up about 40 basis points. So we're watching it and keeping an eye on it, but right now it's looking like the rate's about 1.83%. Now, that's inclusive of a calculation when you look at the premium that's estimated that we could receive. Because if you look at the actual amortization schedule, you'll see that the coupons are around 3% and 5%, and that makes it more attractive for the buyers want to buy when they buy the bonds. They would like to see it. But then if we get the premium of estimated about right now about $5 million, that's money that we could apply to other projects, but we only pay back the $30 million.
So you're expecting a rate of 183?
An all-inclusive rate with all the interest
I
and the
agree,
cost and all that.
And the last time we went, we got 217.
Right. So it looks like we're in better shape. So we're,
Well, my thought is that I follow 10-year treasuries, and I see they're up to $1.55, and with that's twice what it was a year ago. My point gets to be is that, look, there's going to be pressure on rates to go up. I really believe 183 if we can get something like that, anything under 2 is going to be
I would say.
Outstanding.
Exactly.
Get
Exactly.
it
So
done
they're
before-
watching it.
Now, we're going in May, you said?
We actually sell in May, on May 11th, and we plan to close on May 25th.
What can
So
happen?
right now, they're watching. There's a handful of issues in Maryland that are getting ready to come to a sale in 30 to 60 days. So we're watching those now and seeing how they do.
I'd love to see sub 2%.
I agree with Commissioner Ewing that the number's up to I think it was up to 1.61 yesterday, 1.62.
10 years, 161?
Yeah, and then you listen to some of the financial analysts, they're looking at 1.7, 1.75. So I think the sooner we get this done,
Yes.
the better off we're going to be for this issue.
Right.
Well, the thing about treasuries has always been my expectation is when they get to 3, that's when it flips and you get this really big
You get the
increase in
inversion.
interest rates. Yeah.
Right. So we're moving forward.
Keep
I
it
move to approve and execute the resolution authorizing the sale and issuance of general obligation bonds in the amount of $30 million to fund previously approved capital projects as described in the resolution, and authorize the Commissioner President to sign any related documents.
Second.
Have a first and second, all in favor?
Aye.
Aye. Any disapprovals? Ayes have it. Thank you.
Thank you very much.
Thank you, Commissioners, and this completes County Administrator time.
Okay, we're going to go right into Commissioner time. We'll start with Commissioner Morgan.
Thank you, Mr. President. Couple of things. First of all, big night tomorrow for Norma Pipkin and Grace Fuller. Norma's been the one who's been, I guess, organizing most of the virtual symposium on women, and Grace Fuller will be the recipient of the big award. So
That's
congratulations to them for
Thursday, not tomorrow.
What?
Not tomorrow, Thursday.
I apologize. Thursday, not tomorrow. Tomorrow. Okay, got it. Thank you, Mr. Colvin. So that's obviously some of our discussion earlier with legislation in Annapolis. There's going to be a fast and furious next month up there as things try to get sorted out. Please remember that in the whole thing, there's still no budget. Ironically, we discussed bills, but budget seems to be sort of an afterthought at this time. This afternoon, another round of the budget. We'll see where things go there. And lastly, I want to thank Dr. Smith and Board of Education President Bailey for working to get kids back to sporting events. Now, we opened the field so the sporting events can take place. But one group that's really been sort of, I try to think of a nice word to use, hurt, and this is this year's high school senior classes. Remember, the COVID started last March when they were juniors, and here it is March of their senior year, and they still haven't had a normal senior year yet, and they're down to 3 months to go. So Dr. Smith and Mrs. Bailey worked, and we're now going to be able to get the kids to be able to go to sporting events outside, practicing all the social distances and CDC rules and things like that. So I think it's good, particularly for the seniors, getting to go watch their classmates in the last season. We got football going on now. We got some indoor sport things going on now. So I think it's really good that, these kids are actually going to be able to do something their senior year versus, sitting home and watching everything virtually or being told, got to sit 6 feet away and you can't talk and see your friends, et cetera, et cetera. So they're back in school. The sporting events are going on. Kids are going to be able to go watch sporting events, particularly good for those seniors. And last but not least, please don't forget, Green Eggs and Ham tomorrow, green beer. I don't know if Green Eggs and Ham is still a legal book to read out there, but happy St. Patrick's Day to everybody.
Any legal book to read?
Yeah, you never know. Cancel cultural strike next. One, definitely happy St. Patty's Day. If you're going to celebrate safe. Don't drink and drive. I know there's initiatives across the state for those that decide that they want to go out and get behind the wheel. So just be prepared for the consequences if you do. So, but I hope you don't. Uber, Lyft, things like that. I don't know that I'll have green eggs and ham. I have no clue. Maybe some green tea, do something like that, go from there. I will say that we did have the Equal Pay Day recognition today, and I've been thinking about it, jotting some notes down from what Commissioner President said, and I think it works out great that we had it today, even though it's not until sometime next month, because I think maybe it deserves a little bit more recognition than a single day. So here we sit, and we have the banquet on Thursday, recognizing the achievement of women and what they do and how they do it, and how they strive for excellence. And then we have Equal Pay Day. And I think some people miss the mark sometimes on the Equal Pay Day, and you say, I don't understand how in 2021 there's no equal pay. But you have to look at it from a different aspect in where we are as a society. And it's not just the pay for the job, it's the steps that you're in at that job. If you're a grade 13, step 5, and you're doing the same type of work as somebody that's a grade 15, step 6. So you have that schedule, but then you also have the people that work in paramilitary organizations. You know, it's about position, it's about rank, it's about the limited opportunities presented to some to achieve those higher levels as their male counterparts. So, and they still take on the same tasks, if not more. So there's still roadway blocks and obstacles in these roadways that are there, and you have to recognize them and say, you know, at some point we hope these obstacles will be taken down, moved out of the way for those that are striving to do more and get paid equal for what they do in their jobs. So it's evident, it's clear, you can see it, and recognizing it, I think, is the most important thing, and that's why I'm kind of glad we had Commissioner President Sky's blunder with the proclamation, and we can get a whole month out of this one. No, it's either way. But look, nice weather's upon us. Motorcycles are out in full force. I say it every year. Look twice, be courteous, and make sure that you're paying attention to them on the roadway. You know, they like motorcycles got 2 wheels and no barriers, so the only thing that's happening is them hitting the pavement. So let's be careful of them out there and save a life that way as well. Thank you.
Commissioner Colvin.
Well, the other commissioners mentioned it. We have a budget work session this afternoon. We've been going through a marathon of every week budget work sessions, and we're getting close to the end here. We're going to start narrowing down, whittling down, and coming up with what our final budget's going to be looking like. So we're tune into that if you're able. It should be a productive day today. We had a week of gorgeous weather. Winter's still trying to hold on a little bit, but I heard ospreys, the sound of ospreys. They're a loud bird. You can't mistake them, and it's great to hear them. It means spring is coming. Happy St. Patrick's Day. Commissioner Morgan's going to be eating his green eggs and ham. I'm going to be having corned beef and cabbage. I'm looking forward to it. Thank you.
Mr. Hewitt.
COVID. The governor's relaxing some of the restrictions. Lord knows we can be more restrictive than the government, or the governor, but I don't think there's any inclination on this board to want to be more restrictive. We want to work with the governor, and we're glad that this COVID thing is getting behind us. Good news today from the Board of Health. Or from the Health Department, with the number of cases dropping. I mean, only like about 8 weeks ago, it was up to 400 and some. Now it's down to 74. Good news on that front, too. So, but it does go to the budget process, and 6 new nurses. Lord knows there's a lot of people that need a lot of stuff, but one thing we have to be sensitive to is this health department. They have done so much, and whatever we can do to help them, we need to be there for them. Annapolis, the legislature with so much going on up there to control different things in our lives down here. 4 weeks to go. April 12th will be sign and die. That's when they get done. The next 4 weeks are going to be very, very I shouldn't say stressful, but they're going to be filled with a lot of activity. And hopefully we'll find out what's going on here in the next 30 days. We'll know how it impacts us. St. Patrick's Day. Had corned beef and cabbage on Sunday with my family. Thank God my grandchildren come over and my daughter and son-in-law. And the point is my 4-year-old granddaughters, twins, Charlotte and Eva, they're talking about catching a leprechaun. They think they're going to catch one. They looking into a trap, and they think they can get one out there by their house. So good luck, Charlotte and Eva. I don't know what you're going to do with it when you get it. They say there's gold there somewhere, and they think maybe they can get it, but good luck with that. Lastly, Commission on Women. Last year we had to cancel the banquet again. Look, it's always overflowing there. More capacity than, more people want to get there than the capacity of the building to hold them. It's been a great event. Grace Fuller, Rich and Grace, two wonderful people that do so much for St. Mary's County, and it's a great award for Grace. I'm very happy for her and for everybody who's getting awards for Women of the Year and the teenagers and the young women of the year too. So congratulations. Thank you.
Okay, good. Thank you, Commissioners. Yeah, unfortunately, I think we're going virtual again on the women's banquet thing here, and also it's too bad, but congratulations to all those involved. Spring is here, and for those of you who have started to get out and do a little gardening, my wife dragged me out Saturday, and we started doing some gardening, and I put too much pressure on the shovel, digging up some bushes she wanted removed, and end up pulling a muscle. Had to go to the doctor yesterday. So be careful when you also go out there. I told my wife that. I showed her.
Little ailment every time it comes.
I said, we got to do something about it. I'm getting too old to do all this kind of stuff. And I offloaded 30 bags of mulch, from the...
You're working.
And I'm telling you, it's just too much. So my wife said, well, maybe we did look somebody else. I can't handle it either. So, well, she gave me she said, why don't you buy 2 cubic foot bags rather than 3 cubic foot bags of mulch? I said, that's all they had at Golden Beach to sell was 3 cubic feet. That's the ones I bought. Because they were
mulch
really
advertising. Mulch Madness
Yeah.
at Meadow Farms. 3 cubic foot bags for the same price you can buy a 2 cubic foot bag at half the other stores. And today's the last day for Mulch Madness.
No, he won't either. Not anymore. But this is for a good cause. Golden Beach had a big sale and everything, and so I always get at least 30 bags in. Because the only problem I have is I'm wondering every year I get the same amount and put it sort of in the same place, it disappears. I must have a mulch thief. I need to get a criminal investigation. I'll get Commissioner O'Connor to investigate where my mulch is going. But it keeps disappearing every year.
That's right.
I do the same thing every year, and it keeps disappearing.
I'm on it.
Okay.
On it.
On with that. I want to also let people know we were talking about, for those who are involved in any way with the VA, I called the C-Box last week, and they have shots for coronavirus. So any of y'all that are involved at the Veterans Administration, or if you haven't, get involved and go to either the C-Box down in Lexington Park or the one up in Charlotte Hall, or give them a call first. I'm sorry, you just can't go. You got to call them and get an appointment to get your shot there if you want to. It's up to you. Totally up to you. And I think the same number for adults, for the seniors, is 301-475-4200-1049 for seniors to call. And had numerous people say that was the greatest thing, the advice I ever gave them. They're either call there, put on this list, and immediately got an appointment. And you have to go through fill out the paperwork and everything. So it's up to you, but go ahead. We encourage, especially the seniors, to go ahead and get all those inoculations done. With all that said, St. Patrick's Day is coming tomorrow. I will have my corned beef and cabbage.
Good.
So that's what I like to do on St. Patrick's Day. I don't know about green beer. I'm not sure about that, but I could put some dye in my beer, I reckon. But we'll just go with the corned beef and cabbage for sure.
You can always have that Irish whiskey.
Oh, got the Irish whiskey now. That's really good.
A little sip of that.
I'm still sipping. That's a little small sip of that.
Jameson will be doing good.
Oh, yeah, they love it.
Oh, the taste.
Okay, with all that said, I also like to remind people we're still in this heavy budget process the next couple of weeks. We still don't know what they're going to do for Annapolis. Just give one example. If they do pass the SDOT, which the government tried to get done last year, it will cost us an additional $400,000 at this county level, our little county. $400,000 more just from one bill if the governor truly pushes through, or the legislators do. And believe me, they're trying to push everything they can on the counties because they don't want to raise taxes either. But it could force us to look at our budget a little differently. So remember, we're still waiting, so be patient, and we'll get a budget process done. Remember to show up today, 1:30 p.m. We have our next budget work session. With that being said, meeting closed.
Commissioner
Mr.
Johnson.
President. Mr. President, I have a motion to move into executive session for the purpose of discussing litigation.
Second.
Second, I'm sorry, we have first, second for litigation today, right after this meeting.
Right. But just keep right on going.
Everybody say aye? Aye. Any nays? Ayes have it.